So I've had a lot of excitement going up to this. Not excitement, yay, happy, but a lot of, um, a lot of, oh gosh, what's the word? I've had a lot of trepidation to do this, but I also feel that I should do this. Um, I'm going to be calling every Planned Parenthood in the United States live here on live. And I'm doing this not with a purpose of fighting about pro life versus pro choice, but more to get the viewpoint of, is this really what is what pro choice and what Planned Parenthood is saying that they're doing? Do they actually do those things, or are they just saying that they're doing those things? So I'm going to actually share this on a few different groups real fast. Um, and then I will start calling. If you guys have any questions, I'm going to go over the questions that I'm going to ask them. Um, and I really, recommend that you guys watch this through the entire thing. Um, I know that I am really nervous about doing this, but I know that it's what's right and what should happen. Um, and I know that it is something that's important for children and it's important for families and it's important for people to know really what does Planned Parenthood really stand for and what does Planned Parenthood actually do. And so I actually have a list of questions that I'm going to be asking Planned Parenthood when I call, and I'm going to read them to you guys so you guys know what I'm going to ask. I'm going to say I'm 3 weeks late for my period and I just got a pregnancy test and I'm scared the baby isn't okay. Number one, can I come in for an ultrasound to make sure the baby's okay? Number two, what if I don't want an abortion? Number three, will your doctor still see me for my pregnancy? Number four, what can you do for me? Number five, if I say yes to an abortion, when it's too late to change my mind? And number six, something that no one has touched on, if if I'm just so scared, do you have a therapist or someone to help me through this? So I want to ask all of these questions and we're going to do this live and I need to hurry and get on the phone and start doing it because I am a little worried that people are going to start calling the centers to let them know that I'm going to be doing this. So I'm going to actually start calling right now. And I actually got all their phone numbers and everything off of their website. So I'm just going to call them randomly so that if they do find out that I'm doing this, they won't know which the next one is that I'm going to call. So, all right, so I'm going to call the first one. Well, not the first one on the list, but just the first one that I randomly scrolled down to. I actually put it in a PowerPoint. I actually put it in an Excel spreadsheet so that I can be able to get that. 526. So I'm going to put this on speaker. I hope you guys can hear this.
Thank you for calling Planned Parenthood. Please listen carefully as our menu options have changed. To schedule an appointment, press 1. If you know your party's extension, press 2.
Sure, we'll schedule an appointment.
Thank you for calling Planned Parenthood. Para continuar en español, oprime el 3. If you have general questions regarding our services or would like to schedule a health center appointment, please press 1. If you have questions about our abortion, please remain on the line and one of our staff members will be with you soon.
They're taking their time answering the phone. That's interesting.
Thank you for calling Planned Parenthood. This is Denise. How may I help you?
Hi Denise. I'm 3 weeks late for my period. I took a pregnancy test. I'm positive. Um, what is it that Planned Parenthood can do?
Like, what were you planning to do with your pregnancy?
I don't really know. I I've had a lot of cramping and I want to like make sure that the baby's okay. Like, is that something you guys do?
So we can definitely do an ultrasound to determine how far along you are and to determine it is in the uterus, but we don't give a diagnostic. If you were wanting to get a diagnosis in regards to your pregnancy to make sure everything's going okay, we could give you referrals for other prenatal care doctors that will be able to assist you with that.
So you guys don't have doctors there?
We don't do any type of prenatal care.
You don't do any type of prenatal care?
No, ma'am. We don't provide prenatal care.
My friend said that you did. So what can you do for me then? You can just terminate the pregnancy?
Ma'am, what we could do is do an ultrasound if you like to make sure that to see how far along you are to take the pregnancy and to determine is it in the uterus. If you were wanting to continue with your pregnancy, then we could give you referrals for prenatal care doctors.
Okay. If I did choose to terminate my pregnancy, when's too late to like change my mind?
So, which location would you like to come in? If you were thinking on terminating the pregnancy, if you're within 5 weeks in 3 days, up to 10 weeks, you're able to do the abortion pill. The in-clinic, we're able to go up to 18 weeks in 6 days.
Well, I was thinking I was probably only 8 weeks or so. So,
okay.
But you would do an ultrasound to find out how far along I was?
Yes, ma'am.
Okay. But you wouldn't tell me if the baby was okay?
We don't give a diagnostics.
Okay. Do you have like, I don't know, like I feel like I would freak out if this happened. Like, I don't know. I'm really scared and I really don't know what I'm doing. Do you like have like counselors or anything, like if I'm like super upset, like what do you really have to help me? Like if I do choose to terminate the pregnancy, because I just don't know if I have time in my life to do that.
Okay, so you're not sure what you're wanting to do with the pregnancy.
So I'm just not really sure. Like, do you have like counselors or therapists or someone that like can help me through that?
I mean, so what we could do, we could also bring you in for an options visit where they could go over your options. And if you choose to continue with your pregnancy, then we could give you referrals for providers that will be able to help you with that. Okay. Now, if you're unsure, if you're looking for more like counselors in regards to what's going on in your life right now, we could certainly give you referrals for that.
But you guys don't have therapists or counselors on site?
We don't.
Okay. All right. Well, I'm just going to check some other things out and I'll call you later.
Okay.
Thanks. Bye-bye. Okay, so the first clinic that we've called, they do provide ultrasounds. They don't tell you if your baby's okay. They basically tell you if you don't want to have an abortion that you can't do anything there. Will a doctor see me for my pregnancy? They would refer me out if I wanted to have a pregnancy. She actually said this statement that they do not do prenatal care. Specifically. So this was the Denver, Colorado Planned Parenthood that I just called. So we're going to call another one. So no, I can, no. So no on number 1. What if I don't want an abortion? Referral. Number 3, will your doctor see me for my pregnancy? No. What can you do for me? Abortion. If I say yes to an abortion, when's too late to change my mind? She never answered that question. She seriously went around that question. Number 6, I'm so scared. What, do you have therapists on site? The answer was no. Didn't answer. Okay. So that is one of them. So we're going to call another one. What do you think? Okay, guys. Thank you, Rachel. You're so sweet. Totally off topic. Okay, guys, make sure that you are sharing this video. I'm calling every Planned Parenthood in the United States. We're going to get their viewpoint on a list of questions that I have given, and we're checking out to see. We've already called Colorado, and let me tell you, they have some interesting answers. So, okay, so who's our next clinic? Okay, we're gonna go 302-655-7296. Okay, so we're gonna call another clinic. Make sure you guys are commenting. Make sure you're sharing this video.
Delaware. This call may be monitored for quality assurance and training purposes.
Thanks, Gary.
If you are calling the medical office, press 1 now. Si usted está llamando la office. Thank you for calling Planned Parenthood of Delaware. This call may be monitored for quality assurance and training purposes. Thank you for calling Planned Parenthood of Delaware. Para español, oprime el 9. If you know the extension of the person you are calling, you may dial it at any time. To schedule an appointment, please press 1. For directions,
Okay, so we're
please
calling
hold on
Delaware.
while I try that extension. Hang up and call 911 or go to your nearest hospital emergency room. Thank you for calling Planned Parenthood of Delaware. All of our representatives are assisting other customers.
We're gonna have to sit
Please
here.
hold for the next available representative.
I hope no one has like outed me already. And caller number 1. So these are the questions we're asking.
Sometimes you just can't tell.
I know they're backwards for you guys, but sorry. Make sure you're sharing this video, guys.
Even if you don't think you're at risk. All of our representatives are still assisting other customers.
Can you guys hear my phone okay?
If you would prefer to leave a message for ask about STD testing today.
Ask about STD testing today. I think it's interesting that they consider each.
Is committed to maintaining patient confidentiality.
Thank you, Kelsey, for sharing the video.
The Health Insurance Portability and Accountability Act.
I think it's interesting.
Thank you for calling Planned Parenthood of Delaware. One of our staff will be with you shortly.
I don't want to accidentally throw off if I'm in the middle of a sentence.
Or go to your nearest hospital emergency room. Do you know you can schedule an appointment on your cell?
I'm going to share this a little bit more. Thanks, Joanna. Thanks for sharing. Yeah, I just found out that I was pregnant. I got too busy with life, didn't realize I missed a period. And I think I'm pregnant. And I'm just kind of scared the baby's not okay. Like, can I like come in for an ultrasound to make sure the baby's okay?
We don't do ultrasound. It's usually done when we only do ultrasound when that you're coming in for a procedure. You don't set up appointments for that.
Okay, so you just do appointments for setting up. So like
the only time that we do ultrasound is when we are setting up appointments.
When you're setting up an appointment?
Mm-hmm.
Okay, so
if you want to have an ultrasound done, we don't. You're going to be charged $180. Okay, we just don't do ultrasound. We do ultrasounds when we do procedures.
Okay, so you do ultrasounds when you do procedures. So
only when we do procedures. So what you could do is that you could go into a diagnostic center and have an ultrasound done if that's what you want to do.
So do you guys do any like I haven't decided what I'm doing with my pregnancy.
Right.
So like, do you have a doctor that can check me out and can make sure that I'm okay and make sure the baby's okay?
Okay, we don't do prenatal here. Our Planned Parenthood, we don't do prenatal right now. but I can give you some referrals to where you go.
Okay, so is all you can do for me is just an abortion?
We do abortions. We do birth control. We do cancer. We do a lot of things.
You do cancer?
We do cancer screening there. We do a lot of things. It's just that we don't usually do the ultrasound.
So you don't do prenatal care, and you don't.
We're not doing prenatal care. I know some Planned Parenthood do, but we're not doing prenatal care as of yet.
So if I were to go see my doctor or go see a doctor or whatever, and then I decide I want an abortion, when I come in, when is too late to like change my mind? Like, what if I change my mind like in the middle of it? Like, when does that happen? Like, when is like the too late?
Okay. Say for instance that you came in and you had an appointment and you came in and you decided that you won't do it. One of the things that we do when a patient comes in to have an abortion done, we have counselors. And they are going to sit down and they are going to talk to a counselor.
Okay.
If they feel that they're not ready, we will not do it. Okay?
Okay, so are they like, is it like an MFT, or like is it like a licensed therapist, or is it just like a counselor that works for you guys?
I think one or two are licensed, but usually counselors that work for us. And if they don't feel as though, when you're talking to a person, if they feel as though that they're not ready, we tell them, just take your time, and whenever you are ready, and if you're not ready.
Well, when's too late to have an abortion, though? What if I'm too far along?
Okay, some offices act as Planned Parenthood.
Okay.
We only go up, everybody go up to different things. We only go up to 14 and maybe sometimes 15 weeks.
Okay. Okay, well, I'm gonna try to maybe call another place. I haven't decided what I'm doing yet, so I'll maybe call you guys back.
Okay, that'll be fine.
All right, thank you.
Bye-bye.
Okay, so Delaware. Can I come in to get an ultrasound, make sure my baby's okay? The answer is no, you cannot go in to make sure the baby's okay. What if I don't want an abortion? If I don't want an abortion, we will refer you to someone else. Will your doctor see me for my pregnancy? Nope, they don't have a doctor. What can you do for me then? You can check for STDs and give me an abortion. She did say something about like cancer screening, but if you don't have a doctor, like you can't do cancer screening. If I say yes to an abortion, when's too late to change my mind? She didn't answer that question. She reverted to, you're gonna see a counselor. And is the counselor an actual therapist, a licensed therapist? She said some may, but we don't. So, okay, so we're on to the next one. So I'm going to answer those questions on my Excel spreadsheet. So Delaware. Question number 1, can I come in for an ultrasound to make sure my baby's okay? No. Number 2, what if I don't want an abortion? Referral. Number 3, will your doctor see me for my pregnancy? No, we do not do prenatal care. She said we do not do prenatal care. Next one, number 4, what can you do for me? An abortion, STD testing, cancer screening. Which I think cancer screening is not accurate. And I'm just so scared. Do you have therapists or someone that can do this? She said yes, but they're not licensed therapists. Okay. I will have this Excel spreadsheet available when I am done calling all these places. We've now done 2, both of which they do not have prenatal care. They specifically said they do not have prenatal care. Okay. I really want you guys be sharing this video. I really want you guys to share this video. So I'm going to call a very controversial one. We're going to call Washington, D.C. So that's the next one I'm going to call. So 202-457-8500. Okay, we're going to call Washington, D.C. See what Washington, D.C. has to say about the situation. Make sure you share the video, guys. And if you guys can't hear, make sure you tell me so that I know. That sounds like a fax machine, man. Okay, let's try that phone number one more time. 202-457. Hey, Anthony. Hey, Kelsey. Ooh, phone number's busy. I just hope that people aren't warning them, like calling them ahead of time and just saying, hey, there's this lady calling. I want to make sure that it's valid, actual questions. There it goes. Thanks, Malia, for sharing the video. Okay, we have the fax machine again. Okay, that one has to be a wrong phone number. Wrong number. Okay. So I'll call a different one. Okay, let's call this one. Okay, this one is going to be mostly a Black African American community. They say that they don't target the African American community, even though we all know that Planned Parenthood was actually created to terminate pregnancies of African American babies. So we'll have to see what this one says.
Thank you for calling Planned Parenthood Southeast Administrative Offices. If you know the extension of the person you are calling, you may dial it at any time or press 0 for the receptionist. For a dial by name directory, press 1. For health services, press 2.
Look up the research and how it got started.
Thank you for calling Planned Parenthood Call Center. How can I help you?
Hey, I am late and I think that I'm pregnant. So, do you have like a doctor or something that I can see?
Okay, so you should have something for a pregnancy test?
I've taken a pregnancy test. It said it was a light pink, like it wasn't a dark line, but it was a line. So my friend said that I'm definitely pregnant if there's any line, but I don't really know what I'm going to do with my pregnancy. But like, I don't know if I want to terminate or not terminate. I'm just kind of like, I don't know, but I want to see if the baby's okay. Do you guys
so if you want like an ultrasound or something like that to check on the baby,
yeah,
we don't offer standalone ultrasound services. I can give you a referral to someplace that may be able to assist you. What state are you in?
I am in Georgia. I'm in Atlanta.
In Atlanta? Okay, give me 1 second. I can give you some referrals to OBGYNs. They'll be able to assist you with that, okay?
Okay, but what if I decide to do an abortion? Like, what's
okay,
kind of...
so if you want an abortion, we will be able to assist you with that. We offer the abortion services at our locations in Cobb County and Gwinnett County. Okay. You can be measured between 5 to 10 weeks, and that price is $580.
Okay, so it's $180?
$580.
Holy shit. $580?
Yes, ma'am.
Well, like, I'm on does Medicaid cover it? Like, I'm on Medicaid.
Medicaid doesn't cover the cost of the elective abortion. Is that the only insurance that you have?
Yeah, that's the only insurance I have.
Okay. So if you decide to go that route and schedule with us, we can do a screening to see if you qualify for a price reduction, and that can reduce your price by 25%, leaving it closer to $435.
What do I do if I don't have that money? Like, is there any other option?
I mean, we don't turn anybody away for their inability to pay. But the first step is to do the first screening to see if you qualify for the price reduction of $435. If you still need additional assistance after that, you'll have to be sent to my manager.
Okay. Well, like, what if for, like, I'm just a little freaked out. I'm in college. I don't even, I'm just a little frustrated. I don't really know what I'm doing here. Like, if I decide to go with an abortion, like, when's like the last, like when's too far for me to like say no, like,
okay,
never
So with
mind?
Planned Parenthood, we stop at 10 weeks, and then the state of Georgia, they go up to 20 weeks.
Okay, so we go 20 weeks. So Planned Parenthood, like normal plan, like around the country or whatever, right? Like,
So
what do
just the
you
Planned
mean?
Parenthood in Georgia, we stop at 10 weeks.
Okay. So in Georgia, you stop at 10 weeks, and then who's 20 weeks? Like,
There's other clinics in Georgia that offers a surgical procedure, and he can go up to 20 weeks. I can give you those referrals with Planned Parenthood in Georgia. We just stop at 10. We only offer the pill.
oh, I can just like go to another clinic and they'll if like for some, like, say for some reason, like, I haven't decided yet, like at 12 weeks or whatever, like you would just refer me to another clinic and they would do it. Okay. So like, do you guys like have therapists, or like, I'm just freaking out about the whole thing. Like, do you have like a licensed therapist, like not just like someone that calls themselves a counselor, but like an actual like therapist?
No, ma'am, we don't have licensed therapists on staff. What university do you go to? They typically have counselors and things like that you can speak with if you feel comfortable talking with them. But unfortunately, we don't have a licensed therapist on staff.
Okay. Yeah, I go to University of Georgia, so um I'll just yeah. I haven't decided. So okay, I'm gonna call my mom and we're gonna try to figure something out. Okay. I just don't know where I'm gonna come up with the $400 or $500 for the abortion.
Don't be turned off because of the price. Like I said, we never turn anyone away because of their inability to pay.
Okay.
And so, like I said, the first step is to do the initial screening, which can reduce about 25%. If you still in dire need for additional assistance, I will have to transfer you to my manager, and she'll be able to assist you further. Okay? But that's after you schedule an appointment.
So okay. Okay. All right. Well, thank you.
You're welcome.
All right. Bye-bye. Okay, that one was really hard for me to do, guys. Like, that one was really hard. Like, it was really hard for me to fathom going 20 weeks, filling your baby 20 weeks. Like, that is my daughter, Eliza, at 12 weeks. Like, I can't even. Okay, so we're going to write down the stats. I have a lot of Planned Parenthoods to call. So, okay, can I come in for an ultrasound to make sure the baby's okay? She said no. What if I don't want an abortion? We can refer. Will your doctor see me for my pregnancy? No prenatal. Again, she said no prenatal care. Prenatal care. What can you do for me then? An abortion? She never even said STD testing. She never said any other kind of testing. So all she said was an abortion. If I say yes to an abortion, when's too late to change my mind? She said 20 weeks. 20 weeks. Okay. Do you have licensed therapists? She said no. Okay, so that was Georgia. So who else should we call? Let's see. Okay, I'm going to call one that's near where I live. We're going to call another one. Okay, you guys, please share this video. I really want people to understand I'm calling actual Planned Parenthood centers and asking them about their services. This is not about abortion being right or wrong. This has nothing to do with that. This does Planned Parenthood do what they say that they do? Do they do all these other services? Do they do prenatal care? What is it they actually do? Kelsey, I will call St. George. Don't worry. That's on my list of who to call. I have literally the list of every single Planned Parenthood in the United States. And I will be calling every single Planned Parenthood, whether it's today or I do another video and we call other days. This is going to probably take some time, but I want to call every Planned Parenthood and find out the answers to these questions. So, and if you guys haven't seen the questions that I'm asking, these are the questions that I'm asking.
The administration offices of Planned Parenthood of the Great Northwest and the Hawaiian Islands. If you are trying to reach one of our health centers, please press 0 now. As you listen to the following, you may make your selection at any time.
Oh, shoot.
Queries,
Oh, see, this does a whole bunch of them.
Please press 2. To hear our address, fax number, and web address, press 3.
Oh, don't worry, Nicole. We'll be doing California.
Please hold while I transfer your call.
Thank you for calling the Volunteer Information Line at Planned Parenthood of the Great Northwest and the Hawaiian Islands. We have several opportunities for you to get involved. We have volunteer postings on our website at plannedparenthood.org.
Okay, so we're calling.
Click on About Us, then click the Jobs and Volunteering link to search current openings in our area.
Great Northwest.
If you do not have internet access, you may leave us a message at the end of this recording. Please leave your name with spelling and a phone number where we can reach you. You can also leave an email address. Thank you again for your interest.
Okay, so that was simply a voicemail, and it would not let me actually speak to a person. That's fascinating. So I'm going to put voicemail. That's really interesting that you can't actually speak to a person. You have to leave your phone number and they can call you back. I think it's to stop people from doing what I'm doing. But we're going to call another number and we're going to see. Okay, so we're going to check out another number. I think it's fascinating that a lot of these places are not actually, they're clumping them together and their phone numbers are the same. I think actually the lady that I called for another state actually answered the same phone number for Georgia because she actually asked me, where do you live? And that's when I was like, oh shit, which one am I looking at? Atlanta. I'm going to the University of Georgia in Atlanta. I'm gonna look up another one and we're gonna call that one. Okay, we can't call Hawaii yet because it's not open yet. So let's see. Let's try this one. Okay, 509-248. Please make sure that you guys are sharing this video. Share your feelings about this video in particular. Let people know what I'm doing, and I really recommend that you guys share this video like crazy. Thank you, Moroni, for sharing the video. And on to the next call, guys. Let's see.
Five 9-248-3628 has been disconnected.
That's fascinating. That one's been disconnected as well. So both of the Planned Parenthoods in Idaho and Washington have been disconnected. That's fascinating. Disconnected. Okay. let's call this one. Oh, this is I hope I get someone on this one, because this one, 592 6800. Ooh, I think this was the number I called earlier for another one. Hold on. Let me make sure. I think this was a similar number. Nope, it's not the same number. Okay. Okay. Make sure you guys are sharing this video. Hello?
Hello, this is the Administrative Office of Planned Parenthood.
Oh, this is the administrative offices.
Yes, how may I help you?
Oh, I was trying to call a clinic.
Okay, I can give you the contact number.
Okay, for the one in Chicago?
Well, it makes the appointments for all our health centers.
Oh, okay. What's that number?
630-585-0500. And they can help you with any health center in Illinois.
And they can help me with anyone in Illinois. Okay. Okay. Thank you.
Right. Bye-bye.
Bye-bye. Oops. I hope she didn't hear me say, share the video. I lived in Washington State, and there's one in Richland that had closed down. I know there's a lot of them that closed down. Okay, so the number that I called for the Illinois one, she gave me a general number. So the number that I had for them was actually their main number for that state. And so now I'm going to call the call center, I guess. So we're going to call the call center for Illinois. So 630, which is really fascinating that they don't have that publicized. 585-0500. Okay. So
Thank you for calling Planned Parenthood of Illinois Aurora Health Center. You can now book an appointment online by visiting our website at ppil.org. For English, press 1. Para escuchar el menú en español, please listen carefully to all 4 options and select the one that will help us best direct your call. Appointment, press 1. Hours and You have reached Planned Parenthood of Illinois. Please choose from one of the following options to better assist you. For family planning services, including annual exams, birth control services, pregnancy and STI testing, colposcopy, and leak services, press 1. For abortion services, press 2.
pressing 1.
Thank you for calling Planned Parenthood. My name is Alda. How may I help you?
Hi, Alda. I just found out that I was pregnant. I was like 3 weeks late. Like, I didn't really I didn't pay attention. I was like, oh, I'm late. And so I took a pregnancy test today. It was just a really faint line. My friend's like, yes, you're pregnant. And I'm like, no, I have shit to do in life. And so can I don't know if I want to get an abortion. Like, I haven't decided that. Like, I don't know what I'm doing. Like, I don't know. So like, if I came in, like, and I decided to keep the baby, like, could your doctor still see me? Or like, would I be able to check to make sure the baby's okay? Like, what's kind of what can you do?
Okay. So, I mean, if you are, not unsure of what you want to do, as far as like the different options that we offer as far as abortion services, all of our abortion services do have an ultrasound. So would be the first thing that would be done, and that would be to be able to see the viability, how far along you are in the pregnancy.
Would I be able to know if the baby's like okay?
What do you mean?
Like, would they tell me that the baby's okay? Like,
well, yeah, they would determine the health of the pregnancy and how far along you are. That's the purpose of the ultrasound. The only thing they wouldn't be able to do is tell you, if it's a boy or a girl, or the gender.
Okay.
But they would be able to confirm with you the viability, which means it's the health, or the amount of weeks that you are.
Okay.
At the event, I mean, the way we book things is by, if you're ready to book for like an abortion services, you book it typically once you do the ultrasound, and then in that appointment, if you decide you do not want to go through with it, that's where they will end the appointment after the ultrasound, and you would just, be along your way. They can refer you to different doctors like OBGYNs and things like that you can go to. But that's as far as the appointment goes, it just is your decision.
So will
if you were not to keep it, if you wanted to keep it, then yeah, they would just refer you.
So basically what happens is I come in for my appointment. If I want to keep my baby, then if I want to keep it, whatever, I can come in and I can get an ultrasound just to make sure it's healthy. And then...
Well, that's the first thing that's done. Yeah, that's already done on the day of the appointment. You don't have to come back for it because it's already going to be done that same day.
And that's regardless as if I choose to have an abortion or not.
Correct. I mean, it's going to be an appointment for an abortion service, but if you decide not to continue with the pregnancy, then, the appointment would end. They wouldn't provide, obviously, the abortion service, and they would just, refer you to a doctor.
Okay, so if I don't want an abortion, they would just refer me after I had an ultrasound.
Correct, yes.
So would it be a doctor that did the ultrasound and stuff, or?
It would be we have nurse practitioners, so we don't have like actual doctors that do like the whole prenatal care.
Okay. So it's pretty much the ultrasound is there pretty much their ultrasound like the prenatal care?
Well, the ultrasound would be just to determine the health of the pregnancy and then how far along you are. After that, they can refer you out to like a doctor, like an OBGYN. They have plenty of, options as to where you can go for that.
Okay. And so if I decide to do an abortion, like when's too late? Like at what point is it too late for me to have an abortion?
Well, we do the services up to 19.6 weeks of pregnancy. We start off at 5 weeks.
Okay.
So anywhere from 5 to 19.6 is basically the time frame, I guess you can say.
Okay. And then like if I came in and I was like, okay, I'm going to get an abortion, at what point in my appointment could I be like, no, I changed my mind?
Well, it can be really at any time.
Okay.
Mm-hmm.
And then like, do you like have a therapist or like someone like for mental health services in case like I lose my mind over the whole thing?
I mean, we do have a staff member. We do have social workers in office.
Okay.
Just depending on what office you
are they licensed?
I'm sorry?
Are they licensed?
Yes.
Oh, okay. Okay.
Absolutely.
Okay. All right. I have to decide what I'm doing. I'm gonna call my mom and kind of go over like, I forgot to ask, how much will it cost?
So it just depends on how far along you are. So if you're under 14 weeks, if you wanted to do the medication, it's from 5 to 10 weeks, and that's at $470. And if you wanted to do the in-clinic where you can be sedated or awake, the sedation is $470, and to be awake with the numbing of the cervix is $420.
So this could like be like close to $1,000.
No, you're not gonna. No, it's $420 if you want to be awake with the numbing of the cervix. That's just one option. The second option would be if you wanted to be sedated to put to sleep is $470. You have to choose one or the other.
Oh, okay, not both. Okay.
Right.
So is that done by a doctor or by the nurse practitioner?
No, that's done by a doctor.
Okay. And then what if I can't afford, like, I'm a college student. I don't have money for that.
I mean, we offer financial assistance. It's based off of your income and size of household. Depending on if you qualify, they can reduce the cost, but you would still be responsible for the remaining portion of it.
I do have Medicaid. Like, does that help at all?
No, Medicaid actually would not cover an elective abortion in the state of Illinois.
Oh, crap. Okay. Okay, well, I will call you back later and I'll try to figure something out.
Yeah, you can always go on our website as well. There's a lot of information as far as our services go.
Okay.
So it'll be ppil.org.
Okay, awesome. Thank you.
You're welcome. Have a great day.
You
Bye-bye.
too. Bye-bye. So Illinois was fascinating. So Illinois, okay, so we're going to go down the list of questions. Can I come in for an ultrasound to make sure the baby's okay? They actually said yes on that one. So hurrah for them. If I choose not to have an abortion, they will actually refer me out. That's actually I'm actually happy to see that there is a clinic out there that does that. So if I don't want, what if I don't do an abortion? They're going to refer me. Will a doctor see me for my pregnancy? No, they're going to refer me. What can they do for me? They can give me an abortion. If I say yes to an abortion, what's too late to change my mind? Did she say 19 weeks and 6 days? And then, yeah, I thought that was interesting that it costs $470 to do that, which is crazy. I'm just like blown away by that. And do you have therapists? They actually said yes, they do have therapists. So, of all the abortion clinics, of all the Planned Parenthoods, okay, so Chicago's not so bad. So, okay, let's try another one. All right, where should I go next, guys? What one do you want me to see? Which one do you want to see next? Okay, we're gonna call all of them. So let's call the middle of nowhere. Let's call Iowa. Ooh, but it's the affiliate corporate offices. I don't know. All right, let's call Kansas. Let's call Kansas. Let's call the middle of nowhere. Remember, guys, keep sharing this video. Keep sharing this video. Oh yeah, California, they're brutal. Okay, I'm gonna go up to California ones. I'm gonna go to where I'm from. I'm from San Bernardino, so we're gonna call the California San Bernardino clinic. This one kind of hits home for me because this is where I'm from. So, we are calling all of the or not abortion clinics. We're not calling them abortion clinics. We're calling all the Planned Parenthoods in the United States, to basically see what they can do for me if I'm pregnant and see what they can do. Okay, so we're going to call 714-633-6373. I really felt that I needed to do this.
Planned Parenthood, this is Lizette. How may I help you?
Hi, Lizette. Oh my gosh, I went to school with a friend named Lizette. Anyway, I just found out that I'm pregnant. I think I'm like about 3 or 4 weeks late. I'm not really sure. I did take a pregnancy test today and it said positive, like it had like a line on there, so I'm pretty sure I'm pregnant. So I'm just curious, like what can I do? Like I don't really know. Like everyone's like arguing right now, like can you get prenatal services with Planned Parenthood?
Let me go ahead and transfer your call to the scheduling department, and they're going to better assist you with your questions, okay?
Okay, thanks.
1 second. Thank you for calling Planned Parenthood of Orange and San Bernardino County. For English, please press 1. Para español, oprima el número. Thank you for calling Planned Parenthood Health Services. We're here every day with an open mind, a caring touch, and smart advice. Our services are confidential, and your health information is always strictly protected. To best serve you, please choose from the following options or visit our website at plannedparenthoodosbc.org. For health center locations, directions, or hours, press 1. To make an appointment, press 2. Your call may be monitored or recorded for quality assurance purposes. Our health services staff is working hard to provide exceptional care. Someone will be with you shortly to make your appointment. There are 3 callers ahead of you in the queue.
All right.
Many of your questions can be answered
We have
on
3
our
callers
website
ahead of us.
at www.
So make sure you're sharing this video. Make sure that you're telling people about this video.
Get in for your
I have no idea
appointment
what
quicker
any of the
by filling
clinics
out
are
your
going to
forms
say.
in advance and
I have
bringing
no
them with
idea
you.
the answer.
Download and print your forms and more at
But I want to see what they're going to say.
www.PlannedParenthoodOSBC.org.
These are the questions.
Our health services staff is working hard to provide exceptional.
I don't want to say too much in case they answer.
We realize that accidents happen. That's why Planned Parenthood distributes emergency contraception, or Plan B, at all of our 8 medical centers. No appointment is necessary. Check our website for locations and hours. Did you know Planned Parenthood offers Gardasil, the HPV vaccine that protects against cervical cancer? Be sure to ask your clinician about the only vaccine that helps protect against cervical cancer. Planned Parenthood is just for women. We offer services
My
for
mom
men
just tried
as
calling
well.
me.
STI and HIV testing, condoms, education,
Right.
and emergency contraception. Thank you for your patience. An agent will be with you soon. Many of your questions can be answered on our website at www.PlannedParenthoodOSBC.org.
No accident.
Get real-time answers to questions about your body or sexual health. Our health educators are waiting at www. Thank you for calling Planned Parenthood. This is Jennifer. Can I help you?
Hey, Jennifer. I'm a little freaked out. I go to Cal State. I am in school. I don't have time for this. I just found out that I guess I'm pregnant. And I haven't really decided what I'm going to do. I don't know if I'm going to, I know I can't keep the baby, but I don't know, maybe adoption. I don't know. I don't know if I could go through a pregnancy and then give up the baby. Anyway, I'm freaking out, and what basically can you guys what can you do to help me?
Well, I can bring you in for a pregnancy test, and then they can go over all your options with you.
Okay, well, I already took a pregnancy test. It said that I'm positive.
Okay. Well, I mean, then then the next step is up to you. Whatever you decide to do.
If I were to, I'm not going to keep the baby, but if I keep the pregnancy and then I decide to gave the baby up for adoption or whatever, could you do the prenatal services? Do you have
prenatal care?
You do?
We do.
Oh, okay. So what do you do for prenatal care?
Okay, so do you have any insurance?
I have Medicaid.
Oh, you do?
I have Medi-Cal. Okay. I have Medi-Cal and Medicaid.
Okay. How old are you?
I am 22.
Okay. And you have Medi-Cal and Medicaid?
Mm-hmm.
Okay. So because you already have insurance, you would have to find your own OP. Because usually, like when we offer our prenatal care, we help them to get insurance, and then we see our patients for prenatal care. But because you have insurance already and you have Medicaid, Medicaid, you can find your own doctor in your area.
Okay. So do you like, I don't understand, like, wouldn't you guys just be kind of covered under that? Like I saw in the news, like, you guys take Medicaid, right?
Yes, but because you already have insurance, our prenatal program is just very strict. So because we do have a prenatal program in Costa Mesa.
Well, I'm in San Bernardino. Like, I can't go that far.
Right now, we only have it in Costa Mesa.
You only have
San Bernardino not able to come down this way, then you can find an OB, a doctor for prenatal care in your area.
Okay. So how do I
understand what you're saying about the Medi-Cal, but it's just because we help our patients get Medi-Cal, and then we continue to see them as our patient for prenatal care. But like I said, because you have Medi-Cal, you just have to go somewhere in your area.
Okay, so what if I decide to go through with an abortion?
Okay.
Like, can anywhere else? Can I, like, my doctor can't do an abortion, can they?
I'm not sure. They can maybe refer you, but I mean, we can help you with. I can make an appointment for a termination.
Okay, so like, can you do an ultrasound to make sure? Like, can you do an ultrasound to check on the baby before I make that decision?
Well, we don't do ultrasound for size and date.
Okay.
But I mean, if we make we can make an appointment and you can talk to the doctor under the discretion of the doctor. They can, help you out.
So, huh?
I'm sorry?
What do you mean?
So if we make you an appointment, it's an appointment for the termination. We do not. Okay, let me back up a little bit. You just want to have an ultrasound done to check, right?
Yeah, I want to have an ultrasound to check on the baby.
Okay. We don't do ultrasounds for size and date. Like, just to check. We don't do that.
So what are the ultrasounds for?
Oh, hold on, okay?
Okay. I'm pretty sure she knows that I'm asking the question. Share the video, guys.
Okay, so what I'm going to do is I'm going to transfer you to our health educators, and they're going to go over all of that with you.
Okay.
With all your options and, explain to you what you need to do. Okay?
Okay. All right. Thank you.
You're welcome. Hold on.
Chat.org.
Make sure you're sharing this video, guys.
Thank you for calling the Planned Parenthood hotline. Hola, y gracias por llamar a la línea informativa directa de Planned Parenthood. If this is a medical emergency and you need immediate medical attention, please hang up and call 911. Your call is very important to us. Presently, all hotline educators are busy assisting other callers and will be with you momentarily. Please stay on the line, and the next available hotline educator will answer your call. Calls may be monitored for quality assurance. While you're waiting, feel free to visit our educational website, betterthansexed.com. Thank you for your patience. Hola, y gracias por llamar a la línea informativa directa de Planned Parenthood. Si tiene una emergencia médica y necesita atención médica inmediata, por favor, llame al 911. Su llamada es muy importante para nosotros. En este momento, todos los educadores están asistiendo a otras llamadas y estaremos con usted en unos momentos. Por favor, permanezca en la línea.
I'm pretty sure she knew that I'm pretty sure she knew what I was doing. I'm a little worried that they know. Yeah, we've been doing this for about an hour. Okay, we're going to hang up with them because I think she knows that I am not doing this for real. So, okay. So, let's click on San Bernardino. Okay, so the San Bernardino Clinic. Can I come in for an ultrasound to make sure the baby's okay? She said no. What if I don't want an abortion? They will refer us. Will your doctor see me for my pregnancy? No. Even though she did say that they would have prenatal care. But she didn't say what the prenatal care was. Like, she kept averting that question. She kept sliding that question. She kept not answering that question. I asked her multiple times and she didn't answer. What can you do for me then? She can give me a referral or she can give me an abortion. Abortion. She never said anything about STD testing. She never said anything about any other kind of services that they provide. If I say yes to an abortion, when's too late to change my mind? She never answered that question. No answer. And I'm so scared. Do they have therapists? I don't think I got to that question. And then she transferred me when she got suspicious of my questions. Okay. So let's call another one, guys. Shall we? Yes, we shall. Okay, so where else do we want to call? Let's call, okay. I'm going to go down to, I had a couple of people request Las Vegas. So we're going to look for Nevada. Okay. Planned Parenthood of the Rocky Mountains. So there's one that's another Denver one. Okay, so let's see. Wow. New Mexico does not have their own. It's all under Colorado. That's fascinating. Okay, let's try Rochester, New York. Let's see what they have to say. So, okay. I have so many people private messaging me right now. Okay. I turned off my private messenger right now, guys, so that I'm not distracted while I'm talking to people. And I am calling every Planned Parenthood in the United States to see what they have to say if I'm pregnant. So, just so we're all aware, I'm not really pregnant. I don't want to freak out my mother. I swear, Mom, I'm not pregnant. What I do want you to do, though, is I want you to, there's a button down below. I want you to share this video as we're doing this. I want people to know what we're doing, and I want people to hear their answers.
We're calling Planned Parenthood of Central and Western New York. Para continuar en español, presione 9 ahora. If this is a medical emergency, please hang up and dial 911. Your call is important to us. Please listen closely as the following options have changed. If you know the extension of the person you are trying to reach, enter it now or press 8 and follow the prompts. To make or change an appointment, ask a medical question, or speak to a medical professional, press 1. To speak with...
Well, I'm going to talk to someone.
This call may be recorded or monitored for quality and training purposes. Please listen carefully as the prompts have changed. To schedule or change a medical appointment, ask a medical question, or experiencing an urgent medical need, press 1. If you are a current patient and are calling to request an extension or refill on your existing medications or about your lab results, test results, for your convenience, we now offer online appointment scheduling. Choose the exact day and time, the reason for your visit, and book online instantly at www.ppcwny.org. A call center representative will be with you shortly. Thank you for choosing Planned Parenthood for your healthcare needs. Staff may monitor your call for quality assurance. For your convenience, we accept all major insurance plans for women's reproductive health care, including student insurance. We also accept MasterCard, Visa, checks, and cash. All services can be provided on a discount fee scale after income verification. Check out our website at www.plannedparenthood.org for hours, contact information, and locations. Thank you for holding. Someone will be with you shortly. Gracias por llamar Planned Parenthood. Tenemos recursos en español en las clínicas y departamentos de educación. Aceptamos seguros de salud incluyendo seguros de estudiantes, Medicaid y Medicare. Visítanos para más información sobre su salud reproductivo. Somos a su servicio. Thank you for calling Planned Parenthood. This is Dawn. How may I help you?
Hi, Dawn. I just found out that I'm pregnant. I really don't know what I'm gonna do. So I'm a little freaked out. Okay, so here's the thing. I'm a nanny and I don't have time for this. I don't know what I'm gonna do. Like, I'm stressed out. I think I'm maybe 8 or 10 weeks along. I don't know. Like, I didn't even realize that I missed a period. Like, yeah.
Okay. Do you know when the first day of your last period was? I can try to see how far along you are.
Probably like around Thanksgiving.
Okay.
Yeah, actually, it had to be around Thanksgiving because I know that I took stuff with me to my aunt's house. So yeah, it had to be Thanksgiving.
All right, so you're about 10 weeks right now.
Okay. So, like, can I come? Like, I don't know if I want to have an abortion. Like, what kind of services do you provide? Like, if I choose to, and if I don't choose to, like what kind of are my options?
Okay, so being that you're that far along, we could do an in-clinic abortion. We do go up to 13 weeks and 6 days for that. If you wanted to continue with the pregnancy, we can always refer you out, another provider who can do prenatal care. Okay. We don't do prenatal care here.
Oh. So, like, do you have a doctor there that can see me for my pregnancy, but you don't do prenatal care?
Correct. So, I mean, we can do, kind of go over some options with you, refer you out, kind of talk to you about things. But okay. Yeah, we do not do the actual prenatal care here.
Okay, so when is too late for me to make the decision that I want to have an abortion?
Well, so you're 10 weeks now. We only go up to 13 weeks and 6 days. What location are you by? Because I can kind of check their schedule and see what they're booking out till.
I'm near Albany.
All right. So let me see. So Albany actually goes up to 15 weeks.
Is there like okay.
All right. So the next available Albany would have is going to be Monday the 20th of February.
Okay.
So let me just kind of see. Oh yeah. So you're definitely still within the time frame. So that would be for the in-clinic abortion. That's Monday the 20th.
Okay. So I'll be far. Would they do it that day?
Yes. So we schedule for the actual termination at that location.
That's really soon. Like, I don't know if for sure I want to do this. Like,
mm-hmm.
Like, that's How much does it even cost?
It can run from $515 up to $600. It does go based off of your blood type, how far along you are, and if you request sedation with your procedure.
Okay. And like, do you guys like have a therapist there? Like someone that's a licensed therapist? Like, I don't know. Like, I don't know about terminating that day. Like that. I don't know. That's
Okay, so yeah, I mean, what they can do is you can come in, prior to that and like do a pregnancy test options appointment. So they can just kind of go over like everything, review your options at that point.
So could they give me an ultrasound, like, or would they only do an ultrasound if I was doing a termination?
Yeah, we usually do on the day of a termination just to make sure that you're within that time frame.
Okay, so basically the ultrasound's just to make sure I'm within the time frame.
Correct.
So you're not going to check to make sure my baby's okay or anything.
I mean, if they feel that, it's kind of going to depend on the situation.
Okay.
But typically, we do not do them.
Okay. All right. Well, I'm going to have to come up with the money to do it. Like, do you guys have any, like, scholarships? Like, any way that, like, I know I don't have $400 or $500, $600 laying around to do this.
Okay, so an option you do have is you can apply for emergency Medicaid. It does go by income, so you do need to bring some income documentation in, but it would cover a termination and a follow-up appointment.
So the Medicaid
and
will
it's just like a temporary, like 45-day insurance.
So Medicaid would cover it.
It would, if you qualify for the emergency Medicaid, yes.
Okay.
Or do you have insurance? I mean,
No, I don't. No, I don't have insurance. I'm a nanny. I don't.
Okay.
We don't really have insurance, so.
Okay. So yeah, I mean, the option to apply for that, that's up to you. If you wanted to try, you can do that. You would apply like day of your appointment, and they would screen you right here. As long as you had your documents in with you, they would tell you if you would be like accepted.
Okay. Okay. All right. I will. So what else can you do for me? So you just basically do an abortion or refer me out, and that's pretty much it.
Yeah, I mean, they can have you come in and like talk to somebody about your options and kind of go over everything with you.
Okay. I'm terrified going that soon, and I don't know if that's really something I want to do. I don't know. I'm just kind of freaking out a little bit.
Yeah, and that's what I was saying. I mean, you can always come in and like make an appointment to meet with a clinician, and she can kind of go over everything with you as far as your options and talk to you about the situation.
Okay.
I mean, you don't have to schedule an abortion. You can schedule to meet with a clinician.
Okay.
And just kind of go over everything.
So is it going to be a doctor that I talk to, or?
Mm-hmm. Yeah,
Okay.
it's a clinician.
Okay. Well, I'm going to call you back. I got to find out where I'm going to come up with that money. So. Okay. All right. Thank you.
Okay.
All right.
You're welcome. Thank you.
Bye-bye.
Bye-bye.
That one was really hard for me not to punch this woman through the phone. Oh, that one was really rough for me. Like I don't know why that particular one was so rough for me. That one was hard. Okay. So that was New York. If you just came on, I had a whole bunch of people just jump on. I just want to let you know what I'm doing. I'm calling every Planned Parenthood in the United States to find out what they will do for me if I'm pregnant, if they will give me prenatal care. We have found one that is willing to do prenatal care. But I think what their idea of prenatal care is an ultrasound to make sure the baby is viable. And then if I choose not to have an abortion, then I will get referred out to another doctor for the rest of my prenatal care. But that's the only one that I've really had. So I was waiting for you to go off on her. Oh, I was really close. I was like this close. But I didn't, I bit my tongue really hard, in a couple of places. So make sure that you guys are sharing this video, letting people know that this video is happening. Like, I don't want the clinics to know that we're doing this, but I want people to know that I'm calling them live. This is not, I have no idea what they're going to answer. I have no idea what they're going to say. I'm doing this video live because I don't want people to think that I'm editing it for my own purposes or any kind of things like that. I want to make sure that people understand that I'm doing this, so that people can really know what it is really that Planned Parenthood is saying, what services they provide. I've only had one Planned Parenthood say that they provide other services. I've only had one. I think this is like the 6th or 7th one that we've called. Okay, so let me answer the questions. Will the doctor see me for my pregnancy? No. What can you do for me? Abortion and referral. What if I say yes to an abortion when it's too late to change my mind? Ooh, did anyone catch how many weeks she said that one was? I think she said 15 weeks. And then, do they have therapists? Did they say yes on the therapist? I think they did say yes. Someone correct me if I'm wrong. I can't really remember. I think they did say yes, that they do. Okay, so you got a lot of people are asking me for Utah. Ask if after the ultrasound they test for gestational age, you can change your mind about the termination. They have actually said yes on that. I have asked a couple of places, Bryn, and they have said that. Albany 16 weeks. Thank you. Okay, so we're gonna put 16 weeks on the Albany. Okay. All right. So I have people asking me to do Utah because I actually have a lot of people on in Utah, because I'm in Utah. So we're going to call Utah. Scroll down, scroll down, scroll down. We should call Pennsylvania next. Okay, Utah, Utah, Utah. All right. Okay, and Utah has a general call center. A lot of these states have a general call center, so I may not actually be talking to the actual clinics. Some of them, they have a general line that they have people answer. So I want you guys to understand, like, when I don't call a certain town, it's not like I really want to call St. George, I really want to call Orem, and the individual centers, but some of them don't even have public phone numbers because they don't want them to know. So oh, that's funny. I didn't know that, Nicole. That's funny. Okay, so we are going to call Utah. Let's see. 801. I remember being a very small child and picketing this very call center, or this very Planned Parenthood, actually. Okay, so we're going to call Utah.
You've reached Planned Parenthood's administrative office. Our normal hours are Monday through Friday, 9 a.m. to 5 p.m.
Make sure you guys are sharing this video.
Planned Parenthood, how can I help you?
Hi, I just found out that I'm pregnant, and I think maybe I'm like 8, 9 weeks. I go to SUU. I'm in Cedar City. This is the number that was on the website. So, what can I what can I do?
Sure, yeah. So are you needing information about termination services or about parenting or about adoption?
I don't really know, like what would Like, can I come in and get like an ultrasound, make sure the baby's okay, or and then can I make the decision later? Like, I don't really know.
Yeah, I mean, yeah, you can come into any of the clinics, talk to them. We don't have ultrasound machines at our clinic, so if that's what you're wanting to do, you may want to check with Baby Your Baby.
Okay.
That's an organization that does like prenatal care and offers financial assistance, things like that. As long as you have like a positive pregnancy test, they can generally help you. If you wanted to just come in and talk about, all of the different options, you can definitely do that with us.
Well, there's
at
pretty
any of the
much
clinics.
just two options, aren't there? Like,
Sure. I mean, you can come in and talk with somebody. I mean, if you're wanting sort of any information, I can give you like phone numbers for adoption or for prenatal care.
okay.
If you're needing information about how termination services in Utah work, I can give you information about that. It's whatever you need.
So did I would assume that I would go to the St. George Clinic. Is there one in Cedar?
No, St. George would be the closest one.
Okay, so like if I went to St. George, would they be able to like do a termination there?
No, you'd need to plan to come to Salt Lake for that. There's only 2 clinics in Utah that are able to offer those services, and they're both up in Salt Lake.
What if I can't get up there?
You could check with another state if another state would be possible, but the way that termination laws in Utah work, you have to come to something called an informed consent session, which is like a class. It takes about a half hour. You could do that at St. George, and you have to do that, and then there's a waiting period law before you could have the procedure done. But you do that, and then you schedule your appointment to come to Salt Lake for the procedure. But there's not any other way that works.
Would they be able to help me figure out how to get up there?
Sure, yeah, they will definitely. If this is a service that you're wanting to have, they'll do everything they can to try and help you with that, for sure.
So, so what's the waiting period?
By law, it's 72 hours. It's a 3-day waiting period. But we like to kind of give folks a heads up, caution them that generally what happens is that because our clinic is so busy, you take your informed consent session 1 week and then have your appointment scheduled for the next week or the following week. So you kind of want to keep that timeline in mind. Especially if you're traveling, though, they'll definitely try and make sure to work with your schedule and make sure that it's a day that, you're able to travel, things like that. They want to make it as easy as possible for you.
Well, if I chose to terminate, like, how would that... you said that there's a waiting period that I have to do. Like, I'm already like 8 or 9 weeks pregnant. It would be like a week to get me in because it's like Thursday, Friday already. And so then I would be like 14, 15 weeks by the time I got to Salt Lake.
Hopefully not that far along. You said you were 9 weeks, 9 to 10 weeks right now?
Yeah, like I'm 9 weeks late. Like I missed 2 periods.
Sure, yeah. So, I mean, generally it's about a 2-week process altogether. Sometimes it can be a little bit shorter, sometimes it can be a little bit longer. But that would put you at about 11 or 12 weeks.
So how late's too late in Utah?
Oh, like 20.
To 20 weeks?
Yeah.
Okay.
Yeah.
Oh wow, this is... whew, it's scary.
Sure, yeah.
Do you guys like have therapists or someone that I can talk to like...
Oh, yeah, absolutely. Sure. Let me give you a phone number. Let me give you this phone number, and it's called the Backline hold on one second. All Options Talk Line, and they'll talk with you about all of the different, all of your different options, things like that. Sorry, give me 1 second. Okay. All right. It's called the Backline All Options Talk Line.
Okay.
And it's a 1-888.
Hold on, let me get a pen. Let me write this down.
Sure.
Okay.
493.
Okay.
0092.
And it's called what?
It's called BACK, BACK, Backline, All Options Talk Line. So it's just like to call and talk to them about talk about your different options.
And they have therapists that I can talk to?
I'm sorry?
And they have therapists I can talk to?
They'll talk with you, over the phone. And then if you're, maybe wanting some more additional or in-depth, then they can help you, find people to connect with. If that's not a good match for you, we've got other people that you can contact. They're just a pretty good general one for folks who are just kind of like starting out and really just like kind of thinking about all of their different
options.
Situations right now.
So in Utah, there are only 2 clinics, and they're in northern Utah.
I'm sorry?
So in Utah, there's only 2 clinics that can actually perform abortions, and they're in northern Utah.
Yeah, they're both in Salt Lake.
I can go up to 20 weeks, but I have to take this little mini class. It's like a half hour long. And you guys can help me go up north. Like, you'll be able to, like, pay for, like, a bus ticket or something?
I'm not entirely sure exactly how that works. But if that's the route that you decide to go, when you come in for your informed consent session, or once you kind of made that decision, they can talk with you about like exactly how that works and the logistics of that.
Okay. Well, all right. Well, that's a lot to think about. Oh, I forgot to ask, how much does it cost?
So it depends on how far along you are. Up until 12 weeks, the cost will be $450.
Okay.
There is financial assistance available.
Okay.
Based on income and family size. If you are eligible for that, it will reduce it to $337.
Okay.
When you and then after 12 weeks, it's still available, but the cost starts to go up each week. At like, you really, if you're concerned for cost, then the thing that you really want to be mindful of is you want to make sure to try to come in under 15 weeks, because at 14 weeks your cost will be $600 with no financial assistance. And at 15 weeks, it doubles. It goes to $1,200.
What makes what makes the difference?
I don't have any medical training. That's
is it like because it's like a bigger baby at that point, or?
Oh, no. I don't have any medical training. I don't know why. That's something that they'll cover with you at the informed consent session. They'll be happy to answer any questions like that.
Okay.
But yeah, so that's just the kind of thing that you want to keep in mind in terms of cost. Because it just starts to go up each week after 12 weeks.
Okay. All right. Well, thank you. I appreciate it.
Okay. Yeah, no problem at all.
Have a great day.
You too. Take care.
Really? Okay. That one was hard for me. Okay. Granted, it looks like Utah has some really great laws around abortion, which is fantastic, in my humble opinion. Again, this video is not about whether abortion's right or wrong, but I'm pretty sure you guys understand my position. But Utah only has 2 clinics that can do it. They're willing to drive me 400 miles to get my abortion. Oh my gosh, like that's crazy. Like, if I lost a baby at 16 weeks, I would have to bury that baby. I couldn't actually just throw it away in the trash. I would have to bury that baby. Okay. Yes, I have actually. Allie, that's one of the questions that is on my list. So if you guys are just joining, I have about 20 new people on that haven't seen before I started talking to Utah. I'm calling every Planned Parenthood in the United States to get their viewpoint on what services they can provide for me as a pregnant person. I'm not actually pregnant. Let's just make this really clear to everyone. I'm not actually knocked up. I just really want to put it out there and see what actually is happening. what are people actually getting answers to? What answers are actually occurring when you call Planned Parenthood? Are they giving you options for other options? That Utah Planned Parenthood is probably the best out of all the ones that I've called so far. And so I'm kind of proud to live in the state of Utah. I can't lie. Because they did give me options, but everything, all the options they gave me were, I'm going to refer you out to someone else, but as far as what we can do for you, we can give you an abortion. So it's just interesting that there's a clinic in St. George, but they can't actually provide abortions there. So that's kind of fascinating to me, but they're willing to help you travel up to northern Utah to have that abortion. So that's very interesting to me. I just happened to put that out there because it was just fascinating to me to know how they were going to get me to northern Utah to actually get this abortion. So I'm going to record the answers in our in our Excel spreadsheet here. Okay. So question number 1, can I come in for an ultrasound to make sure my baby's okay? She said no, they do not have ultrasounds. What if I don't want an abortion? They will refer. Will your doctor see me for my pregnancy? No, they will refer. What can you do for me? An abortion or refer? If I say yes to an abortion, when's too late to change my mind? I was blown away. I couldn't believe that it was 20 weeks. That part made me want to cry, honestly. Yeah, I just did I ask her about the therapist? Does anyone remember if I asked her about that question and what she said? Put in the comments what the answer was. That yeah, and they said they would make it possible to drive 400 miles to go and get my abortion. They would pay for me to travel to get to my abortion in Salt Lake. Only 2 places in Utah can have abortions. Okay. Whew. That one was an intense one. She said yes on the therapy options. Okay. So I'm going to make sure I put yes there, because that's one question that people haven't actually asked. People haven't actually asked. Yeah, and she gave me a number to Backline, which is an options talk line. And then she assumes that they would give me therapy services. So the number that she gave me was actually just a number to an options phone number. What options are available. So, okay. So where should I call next, you guys? You guys tell me, where should I call next? Let's call North Carolina. Seems like a conservative state, right? Let's call North Carolina. All right. Where's my phone? Okay. I just couldn't believe that she said that she would pay for me to travel to my abortion. Like, I was like, what? I'm like, I mean, I have opinions. I'm trying not to put my opinions in this too badly, except for obviously you probably know what my opinions are. But the purpose of this video is to, we've already done New York, Chandra. Hold on.
Please listen carefully as our menu has changed.
The purpose of this video is
Thank
to
you for calling Planned Parenthood South Atlantic and
know
North
what they would
Carolina.
do if I called them.
If you know your party's extension, please dial it at any time.
What options would they give me?
If you are calling regarding services within our health center, please press 1. To reach them,
I did Washington already.
Emergency, please hang up and dial 911. This call may be monitored and recorded for record keeping, training, and quality assurance purposes. To schedule or reschedule an appointment, press 1. To refill a prescription over the phone, we appreciate your call. However, all agents are currently assisting other patients. Please stay on the line and your call will be answered in the order received. If you would prefer to leave a voicemail message, please press 1. If you're an abortion patient experiencing symptoms that require additional follow-up, please
I'll
press
call
8.
Arizona next.
Did you know that you can now schedule your appointments online for family planning services? Visit our website at ppsat.org and select the health center you'd like to visit. Abortion patients, please stay on the line.
I've already called Idaho. That was actually one of the first ones I did. Was Idaho. Oh yeah, I did Washington D.C. already. Oh, we did that one. Yeah, that would. That was fascinating. Wait, no, Washington D.C. The phone number ended up being a fax number. I actually need to look up a real phone number for Washington D.C. Someone look up and try to find Washington D.C.'s phone number, because the number that I have, it's not valid. So someone try to find me Washington.
We appreciate your call. However, all agents are currently assisting other patients. Please stay on the line and your call will be answered in the order it was received. If you would prefer to leave a voicemail message, please press 1.
The worst. I think the worst one so far was the New York one, actually. The New York one was pretty bad. Like, they were really blunt about it. They were like, no, we just do abortions. Let's see. We've done Utah. We've done New York. We've done... sorry, it's a huge list. We've done Chicago, Illinois. I tried Idaho, but it's a voicemail, and you can only leave your phone number, and they have to call you back. We've done Georgia. They were crazy. That one was nuts. I've tried calling Washington, D.C., and I had a wrong number. I called Delaware. There's
call. We appreciate your call. However, all agents are currently assisting other patients. Please stay on the line and your call will be answered in the order received. If you would prefer to leave a voicemail message, please press 1.
That's the number I called.
If you're an abortion patient experiencing symptoms that require additional follow-up, please press 8. Did you know that you can now schedule your appointments online for family planning services? Visit our website at ppsat.org and select the health center you'd like to visit.
Yeah, that's the phone number I have for DC. If you guys can find a different number. Oh, I'm so scared someone answered and heard me say that. If you guys can find me a different number from Washington, D.C., someone find me a better number for Washington, D.C., and we'll call D.C. next. We did San Bernardino. Yeah, I didn't like the answers San Bernardino gave me. Actually, we've done a couple of cities in California already. But I'm kind of jumping around on the list so that no clinic really knows, like, that I'm calling them. Please make sure that you guys share this video. Share it.
All agents are still busy. Do you need assistance finding our location? Visit us at ppsat.org and select the health center and then choose maps and directions.
Michelle, yes, we're asking those questions. We're asking what other things can they do to help me. I've actually only had one clinic tell me STI testing. I'm actually surprised that Utah didn't answer that way, frankly. I'm moving my light away a little bit because I feel like my face is like super bright. I know. Someone needs to share this for sure. Someone tag Tommy Lauren. Or Tommy Lauren. Lord knows she'd want to see this. Nice to have you on, Rachel. Ooh, thank you, Bruce. I'm going to write that down.
All agents are still handling other patients. If you'd be interested in making a donation, please visit us at ppsat.org and select Donate.
I'll try to be Michelle. I'm trying to be specific without them, like, knowing what I'm asked, like, knowing that this is for this. Aw, you're so sweet, Bruce. Thank you. Aw, you're so sweet. Oh my gosh, this is a long hold. I think this is the longest we've been on hold. Maverick is not a sponsor of this video.
We appreciate your call. However, all agents are currently assisting other
Wait,
patients.
who am I calling?
Please stay on the line and your call will be answered in the order it was received. If you would prefer to leave a voicemail message, please press 1.
All right, we're calling North Carolina. I was trying to remember which one we were calling right now. Thank you, Jen. I'm like, which one are we on? I couldn't remember for a minute which one we were on. Well, because I was scrolling up to put the phone number correctly on Washington, D.C. So, this is a little scary. I can't lie. This is it's a lot of babies dying. So you guys want to see the picture of Eliza? See, look. I told you guys I wouldn't ever show anyone my picture of Eliza, but this is Eliza. It's my baby. I figured it was important to have her involved in this.
Will I transfer your call?
We appreciate your call. However, all agents are currently assisting other patients. Please stay on the line and your call will be answered in the order received. If you would prefer to leave a voicemail message, please press 1. If you're an abortion patient experiencing symptoms that require additional follow-up, please press 8. Did you know that you can now schedule your appointments online for family planning services? Visit our website
That's terrible,
at
Mike.
ppsat.org and select the health center you'd like to visit. Abortion patients, please stay on the line.
This is the longest hold ever. Ugh. All right. I'm going to share this on a couple more boards. You guys need to be sharing this on groups and stuff. This is like
All agents are still busy. You need
This is
assistance
like
finding our
the
location?
longest hold ever.
Visit us at ppsat.org and
Like, did
select
they
the
do it
health
on
center
purpose?
and then choose maps and directions.
This is ridiculous. So these are the questions I'm going to ask. I know they're backwards for you guys, but these are the questions that I'm asking them. and that I am taking note of all of the answers of all of these questions. Thank you, Chandra, for sharing this video. I appreciate that. Everyone that shared the video, I really appreciate you guys sharing the video. I don't feel that it's something that it should just go like, la, 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 I can't hear you. Like, you can't just do a Planned Parenthood march and be like, we love Planned Parenthood, and not actually call them and not actually find out yourself what it is they're going to answer. I have no idea what they're going to answer on any of these calls. I've actually been shocked by a couple of them. But for the most part, they're all giving me pretty much the same answers. And, okay. We're hanging up on North Carolina because their hold is forever. So we're going to try that new Washington, D.C. phone number that we got. Okay, so Washington, D.C. It's like way up at the top. It's under D's, I think. Da, 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 da. Okay, there we go. No. All right. One. Delete. I wonder how many politicians' kids get murdered at the Washington, D.C. office. Okay. Washington, D.C. Where is it? There you are. Okay. All right. 301 608 3448. Ooh, this is calling Maryland.
Thank you for calling Planned Parenthood appointment line.
Exactly.
Your call may be recorded for quality assurance. Para seguir en español, presione 1. Did you know you can now schedule most appointments online? Please visit us at www.plannedparenthood.org and schedule with the center of your choice. That's www.plannedparenthood.org to schedule most appointments online.
This is the DC number, but it's showing that it's a Maryland number. It might be one of the general call centers that they have. We'll see in just a second. I explained before that a lot of Planned Parenthoods, sorry, I was making sure they didn't answer. A lot of Planned Parenthoods have a base call center, so they don't actually have a public phone number for the individual clinics. So I think this is a base call center. And if it's a base call center, great, we'll call them and we'll find out. But
your call will be answered in the order in which it was received. If you would like for us to give you a call back without losing your place in line, please press 1. Otherwise, please continue to hold.
There are really that many people asking for abortions right now. I wonder if my phone number has been put on watch or something. I'm curious. Because we've now been doing this for almost 2 hours. I'm a little worried that they've all been notified that I'm calling. I mean, I've been on hold at the last one for a really long time, and now I'm on hold for this one. So I really hope that they haven't been called. But the thing is that it doesn't matter if they've been called and told that I'm calling. I'm not asking any weird ass freaking questions. I'm asking the questions. Can I have an abort? Like, what other services do we have? What other services can you provide me? What can you do if I don't want an abortion? What can do you have therapists that I can talk to?
Your call will be answered in the order in which it was received. If you would like for us to give you a call back without losing your place in line,
I'm just going to set this down here.
1. Otherwise, please continue to hold.
I'm asking basic questions so that this whole music's driving me nuts because it like has a pause in it. So I'm like, are they answering? I can't talk when it's not answering. I want to make sure. Thanks, Dee, for sharing the video. I appreciate that. So we're calling Washington, D.C. We're going to find out. I think I'm going to call, if I can't get through at the Washington, D.C., I'm going to try calling Virginia, because it's Washington, D.C. is in the middle of Virginia. So I'm going to try to call the Virginia one and see if I can get a better answer through Virginia. But I have a feeling that this is a call center number that I'm calling, so that I make sure that I don't cross call. You're so smart. You're so smart. Yes. Hello.
Was received. If you would like for us to give you a call back without losing your place in line,
that just scared me. Okay, so I muted my phone. So if I do get, someone, I can mute myself, or I mute it so they can't hear what I'm saying. So, this is just a matter of a public knowledge, this is why, we've all seen a video kind of traveling around lately about Planned Parenthood being picked on for, they provide all these other services. They provide STI services. They provide cancer screening services. The cancer screening services that we've been told about was basically a Gardasil shot. That was their cancer screening services that they provided. I've only had one clinic tell me about STI testing. I've only had one clinic tell me about their cancer screening, which was basically their Gardasil shot. So those are pretty much the only things that I've really found. And I didn't know the answers I was going to get. I don't know the answers that I'm going to receive on any of these.
Please press 1. Otherwise, please continue to hold.
Please continue to hold. I don't know what the answers are going to be. And I mean, I'm calling the list that I found on their website. I looked on Planned Parenthood website directly, so that I could see what it was that it was on there. And I'm just looking. I'm asking them, if I'm pregnant, what can you do to help me? Almost every single one of them is telling me, we can provide you with an abortion, or we can refer you to someone else. So their particular services, I've had multiple of the clinics that we've called specifically say, we don't do prenatal services. I've had only 2 have said, yes, they do prenatal services. One, their prenatal services was doing an ultrasound, and they weren't going to tell me if the baby's okay or the gender or anything, but they would just tell me how many weeks along I was.
Without losing your place in line,
and if I chose to get an abortion, then they would go ahead and go forward with that abortion that day. One of the most surprising ones was Utah, where they actually said that they would be willing to drive me 400 miles to get an abortion. That was a fantastic one. I have a lot of people messaging me right now. My brother just messaged me. Oh, I'm a little worried about my brothers, because I have actually really liberal siblings. And so, okay, there we go. Oh, oh, my brother's messaging me about something else. So I'm just doing this video so that it's not a cutaway video. It's not something where it's edited. This is an actual live video. You can watch the whole video. You can see me calling the phone numbers. I'm not giving anything. I'm not threatening anyone. I'm not harming anyone. I'm just simply calling and asking questions what they can do for me if I'm pregnant. That's all I'm doing. Yeah, I guess I'm kind of lying to them saying I'm pregnant, but that's pretty much it. Michelle, I've actually asked about mammograms and stuff like that. The only clinic that said that they did cancer screening was New York. And when I asked about it, they said that they they pretty much didn't say anything. So all they said is the Gardasil shot and things like that. So thank you so much, Nicholas. I appreciate that. You guys make sure that you're commenting. Tell me where you're from. I want to see who's on here. I want to see where you're from. We're on hold waiting for us to get the phone to be answered in the Washington, D.C. clinic. And we've now been on hold for that one for quite a while. Thank you, Mary Susan. I appreciate that.
If you would like for us to give you a call back without losing your place in line, please press 1. Otherwise, please continue to hold.
I'm pretty sure that my phone number has gotten out there and that I'm being blocked and that I'm not going to get any more answers. I'm going to keep calling phone numbers though, and we're going to find out. So we've been on hold now for Washington, D.C. for over 10 minutes. We're going to go ahead and hang that number up. I got put on hold there. So I'm just going to write in the comments for Washington, D.C. I'm just going to say put on hold for 10 minutes. Okay, so where do we want to call next, guys? I already called Idaho, Mike. Idaho is actually combined. It's called the Northwest Cities. A lot of these numbers that I'm calling, they're actually like general call centers. Like you can't actually call a clinic. There are a lot of them that are general call centers. And so I called Idaho already. I'll tell you what they said if you'd like. Idaho. I called all the areas around here. So let's see, Idaho. Oh, Idaho, I got a voicemail. So in Idaho, I wasn't allowed to actually talk to anyone. They actually have a voicemail that says, if you want some services, leave your phone number and we'll call you back. I think it's a screening to make sure that you're not able to actually talk to anyone. The Tacoma, Washington phone number was disconnected. I talked to Chicago, Illinois. That one was a scary call. They chose not to they chose not to answer some of the questions that I had. We'll see. I want to know what services they'll provide to me as a pregnant woman. So as a pregnant woman, I want to know how I will get services. So, okay, let's see. Okay. I got off track, guys. Okay, so let's call Connecticut. Let's try Connecticut, guys. All right. Phone number 203 865 5158. Call.
Good afternoon, this is Planned Parenthood. How may I direct your call?
Hi, I just found out that I'm pregnant and I'm a little freaked out.
Well, this is the administrative office. Are you looking for a healthcare professional?
Yeah. I'm looking for a clinic to help me with my, to know what my options are.
Okay, well, hold on, let me transfer you.
Thank you. Jennifer, when did you move to Texas?
Planned Parenthood, New Haven, this is Marielle. How can I help you?
What's your name again?
Marielle.
Oh, how funny. My name's Mary Ellen.
Oh, boy.
I was like, wait, what? Sorry.
Is that me?
I know. I was like, what? Huh? Anyway, sorry. I'm very much nervous laughing. Okay. So here's the thing. So I didn't realize that I missed a couple periods. Like I just realized.
Okay.
I haven't had a period since Thanksgiving, and I went and I got a test, and it says that I'm pregnant, and I'm like, oh my god. So I think
Okay.
I'm maybe 10 something weeks pregnant. I don't know.
Right.
And so I'm terrified. So I don't know. Like I don't know what I'm gonna do. Like I don't know if
Okay.
I want to do an abortion. I don't know if I want to do adoption. I don't know what whatever. Like
Right.
what are the options in Planned Parenthood? Like what can I come in and get an ultrasound? Can you just like tell me how far along? Like can you tell me the baby's
Yeah.
okay or not? Or what's
We do ultrasound here, absolutely. We can come in. We're definitely going to do a pregnancy test just for our records, just to have that in your file.
okay?
And yes, we can absolutely do an ultrasound, which will help us to see more exactly how far along you are.
Okay.
And then that's something that you can come in, and then you can sit with one of the clinicians or one of our CAs here, and just kind of go over your options and how you would like to proceed with keeping the pregnancy, or, I mean, just what the process is for adoption, or if you want to go into prenatal care, or if you are interested in
Okay.
ending the pregnancy.
So
Does that
so
sound good?
so I can get the ultrasound even though I'm not getting an abortion.
Yes,
Oh, okay.
absolutely.
Fantastic. Okay. So, like how, like if I decide to go ahead with an abortion, like how soon would they do that?
So that would depend on exactly how many weeks you are along. There is the pill that you can take that is up to a certain amount of weeks. Although if you are as far along as you say you are, then we probably would have to go with a more of a procedure abortion, and that would be something that we would need to book you an appointment. So that wouldn't be able to be same day if you chose to proceed on the same day as when you come in and see us, okay?
Um,
Um,
well, how much does that cost?
so there are different costs depending on how far along you are. It sounds like just completely out of pocket without any sort of insurance affecting the price, it is $623 if you're less than 12 weeks. Which sounds like that's probably where you are at this moment.
Yeah, I'm kind of at the edge.
Although if it is, you're a little bit farther along, it's about $100 more.
Okay.
Okay.
Would I be able to would I be able to like see the baby?
I mean, we can do an ultrasound, and it is something that we can print out an image. I mean, and yeah, and you can see it with a clinician, and we can print you something out if you don't want to make any sort of decision that day, and we can send you back home with an image and kind of think it over if that's something that would make you feel better.
Like if I did the abortion, could I see the baby after it was born?
That's something actually I would need to check out. Hold it, give me one moment, okay?
Thanks.
Mm-hmm.
That was actually a random question that I thought of. It's a good question. Make sure you're sharing this, guys.
Okay, you there?
Yeah.
Okay, so I just wanted to double check. So really, after we have, you would have the procedure, there really isn't much to see. It's mostly just tissue, and so there wouldn't really be any sort of like visualization of something. It's more that we collect the tissue afterwards and we send it to a lab just to make sure that everything is normal and that there wasn't any sort of like abnormal cells that could potentially affect your health, or if it's suggested for some reason in rare circumstances, if for some reason when you had abnormal pregnancies. But it's more that we would be able to give you an image of the ultrasound.
Okay.
Sense?
This is just really upsetting for me. I'm just like,
oh, I understand. It's scary, especially when you're not expecting it.
Yeah, it was kind of out of left field. So,
Mm-hmm.
So when would like be too like when would be like my cutoff for not being able to like do the abortion?
Well, within our facilities, the very farthest that we ever go in the procedure is about 18 weeks.
Okay.
And then after that, laws are differing, and that would, I mean, that's like a couple months from now.
Okay.
You still have options.
Okay.
Okay.
So what other if I chose to keep the baby, could you guys you guys have prenatal care?
At our affiliate here, unfortunately, we don't have prenatal care. There are other affiliates that do offer that, but we would be able to start you off with all the necessary information of what it's like to begin with a pregnancy, what type of kind of vitamin supplements, how to take care of your body, and then we can also give you recommendations to a lot of OBGYNs that we work with that we refer our patients to for their whole pregnancy care.
Okay. Okay. Well, it's a lot to think about.
It is a lot to think about.
Okay.
I mean, we can book an appointment for you to at least just get the ultrasound, just give you a better idea of how far along you are.
Okay.
And then does that sound good?
Well, how much does it cost?
Just for the ultrasound, to see us. Let's see. You've never seen with us before?
No.
Do you have health insurance?
No, I don't.
Okay, that's completely okay. What we can do is we do have a couple programs. What we can do is the way that we see our patients is we have a sliding fee scale. So depending on what your current income is and your family size, how much you would need to pay is based on that. So I don't want you to be fearful of this huge out-of-pocket expense, okay?
Okay.
So just initially seeing us, the office visit to be able to just like see the clinician, talk with people, go over things. I'm going to estimate it's probably around like $70. And then for the ultrasound, let's see, just to go through that, that's about $60 so that they can visualize the area and then be able to give you a more exact time reference.
Okay.
Does that sound okay?
Yeah. I gotta. How much?
You have to think about.
Yeah. So okay. I'll call you back.
You'll call him back? Okay.
Okay.
No
Thanks.
problem at all.
All right.
Do you have someone to talk to?
Yeah.
Okay.
Yeah. All right. Thank you.
Okay. Take care.
Okay. Seriously? That one made me cry. I asked that question out of nowhere. I had no idea. That was a hard one. Like asking the question, can I see my baby after it's born? And for her to answer, it's just tissue. If my baby's 20 weeks along, that's a big baby. That baby is like this big. That's not tissue. Oh my gosh. Okay. Okay. All right, I gotta pull myself together to call the next number. Okay. All right. Ooh, that one was hard for me, guys. Oh, okay. I was glad that she at least cared at the end. Like, I was glad that she asked, like, do I have someone to talk to? I couldn't ask her any more questions. I wanted to ask the therapist question and stuff like that. I wanted to ask additional questions, but I couldn't keep it together on the phone anymore. I had to hang up. That one was really hard for me. Like I just kind of like looked over at Eliza's picture and I was just like, that's my 12-week-old baby when she died. And that's what I was like. When I had her, I could see her fingers, I could see her toes, like, it's not tissue. Like, it's, that one was hard for me. Yeah, and she did sound caring. Like, I'm not gonna say that she wasn't like caring. Like, she actually sounded like she really legitimately cared about my pregnancy, but I don't, you guys may have to answer some of these questions for me, because that last question, like, whoo, whoo, all right, I gotta cool off on that one. Um, can I come in for an ultrasound to make sure the baby's okay? She did say yes on that one, right? Okay. What if I don't want an abortion? She said that she would basically just refer us out. She said that their prenatal care. She said, okay, sorry, I have to put myself back together. In Connecticut, they said that the prenatal care was just their prenatal care was get them started on vitamins, teach them a little bit about pregnancy, and then refer them to another um, OB. That their doctor would not see them for their entire pregnancy. So on that one, I'm just going to say referral. Number 3, will doctors see me for my pregnancy? No. Number 4, what can you do for me? An abortion. And they actually said, didn't she say 20 weeks? Originally, she said legally 18 weeks, but then later she said 20 weeks. So I'm going to put 18 weeks / 20 weeks. Did everyone else hear that too? Like, I don't know if I was like that upset, but I'm pretty sure she said 18 weeks in the beginning. She said 18 weeks, like that was the legal age or legal amount, and then later she said 20 weeks. Is that what she said to you guys? Did you guys hear the same thing? I wonder if she's ever seen the baby when they do an abortion. Ugh, I know that one was hard. um I did like the fact that they did say that they would print out a printout of the baby for you to take home. And I did like the fact that they did say that they would do a printout of the ultrasound for you to take home and to see. But after the abortion, the baby is just tissue, and I couldn't see it after. That one was a really hard one, guys. Like, I don't know if I can keep doing these. Like, that was a really, really hard one. Brittany, I'm sure I'm going to be on here for a little while, so if you guys just wanted to, like, pop back in, make sure you guys are posting this on your wall. Make sure people are sharing this. I really want people to see this. I'm not sure the people that answer the phone how much medical education, who knows. Same thing in the undercover work with my local abortion mill. I wonder if she's ever seen a baby. Okay, I read that one. Holly, how I came up with this idea is I kept seeing people posting this video about different abortion clinics, about other Planned Parenthood clinics around the country. And they were videos and they were audio clips, but no one's faces were shown. No one had the full conversation. I wanted to post this as a live video so that there's a full conversation. There's no snippets. There's no little bits. It's a full, you guys hear the whole conversation. It's not a snippet. It's not little bits. It's a full conversation with the clinic to find out what can actually happen. So, okay. So I'm pro-life, and life begins at conception. They should shut down all these places and find the companies. Unfortunately, I don't know if that's going to happen, but I hope that this video does some good. I wonder how the ultrasound picture would be, or if they would just try to make them look like tissue. That's a really good question. Or if they would say that something was wrong with the baby, or, I don't know. That's a really good question. I have no idea. Okay, so I'm going to pull myself together and call Florida. Okay, guys, let's call Florida. I'm going to give ourselves like a minute break. If you guys don't mind, I'm going to take a break for just a second. I'll be right back. Keep sharing this video. Tell people what you feel about this. Comment in the comments below. Tell me where you're from, how you got here, and I'll be back in just a minute. I just got to pull myself together, okay? Okay. Yes, I am calling every state, Holly. I appreciate you guys' support. I appreciate you guys being on. I went and I took a little prayer for a little prayer break for a second. This has nothing to do with any religion or anything, but I really, I know you guys just got on here. This is my baby. Her name is Eliza, and last year she died. She was not an aborted baby. She was very much a wanted baby, a very much loved baby. And she passed away. And I feel that's important that, that I do this. I want to know really what Planned Parenthood will answer. I really want to know, what services they provide, at the clinics. And I really want to know, like, I have not called these places ahead of time to let them know. Like, I have not given any, I have no idea what any of these clinics are going to answer or say. Like, look, all my makeup's like washed off of that eye. I have no idea what any of these clinics are going to say, what any of the clinics are going to respond. But I just feel that it's necessary that I do this. So, okay. So we are going to call the next number. So I said I was going to do Florida next, right? Okay, let's try West Palm Beach, Florida. 561. Okay. Make sure you guys are sharing this, guys.
You've reached the Administrative Office of Planned Parenthood of Southeast and North Florida. If you know the extension of the person you're trying to reach, please dial it now. To reach a company directory by name, please press 1. If you're inquiring about medical services or the health center nearest you, press 2. Did you know that you can book an appointment online? Please visit our website at www.plannedparenthood.org. If you wish to book an appointment by phone or speak with a healthcare professional, please hang up and dial 1-800-230-PLAN. That number again is 1-800-230-7526. Please press 0 to reach an operator, or press pound to return to the main menu.
I think maybe press 0.
You've reached the Administrative Office of Planned Parenthood of...
Maybe they'll get me to a clinic.
Good afternoon, Planned Parenthood. Can I help you?
Yeah, is this a clinic?
No, it's our administrative offices.
Oh,
Would you like for me to transfer you to the health center?
yes, please.
One moment.
Which one am I calling? I'm calling Florida. Okay. I had to remember where I'm calling. Sarasota. not answering? Okay, we're going to let that keep ringing. They're not answering. It's not like they're at lunch. East Coast, it's like 2 o'clock. They're not at lunch. We're gonna let it ring for 5 minutes. We're on 3 minutes. Let's see what it has to say. Again, if you guys are just getting on, I'm calling Planned Parenthoods around the country, and I'm asking them a list of questions as if I was pregnant, and I'm getting their answers. I'm doing this as a way of finding out what centers actually do have prenatal services, what clinics actually do provide ultrasounds for pregnant women that don't want an abortion. So, yeah, maybe they're just busy, or maybe they're not. Okay, so we're going to hang up with Florida. So let's call the other Florida number. I have 2 Florida numbers, so let's see if the other one, I can reach anyone. 941 923 5500. I really encourage you guys to share this video.
Thank you for calling the Florida Association of Planned Parenthood Affiliates. If you're trying to reach our Sarasota Health Center, please press 1.
I will.
If you speak to a staff member right away, please call area code 561-472-9940.
Ooh, 671, I think she said. 472.
Thank you for calling Planned Parenthood of Southwest Central Florida. Your call is important to us. Please hold, and the next available representative will be with you shortly.
Please continue to hold.
Oh, so the other number I called was the Northwest, and this is the Southeast Florida. So these are just different call centers for Florida.
Every day to reduce the number of unintended pregnancies. That's why we offer affordable birth control options so that you can make responsible choices about your sexual health. The pills, the rings, the shot, the patch, and IUDs are just some of the methods Planned Parenthood provides to help you take control of your fertility. Our friendly staff will be happy to help you decide which one is right for you. Or you can visit our website at myplannedparenthood.org for more information. At Planned Parenthood, we replace fear with facts and misinformation with education. For nearly a century, Planned Parenthood has been providing healthcare information to prevent unintended pregnancies and sexually transmitted infections. Thank you for holding. Please remain on the line, and a Planned Parenthood staff member will be with you shortly. Your convenience is our top priority. So if you currently have a birth control subscription with us, we can mail your birth control pills directly to your door. For more information, talk to one of our knowledgeable professionals.
Apparently, Florida is big on birth control.
Please remain on the line, and a Planned Parenthood staff member will be with you. Planned Parenthood, Emma.
Hey, so I just found out that I was pregnant, and I don't really know what I'm gonna do.
Would you want to come in and speak to someone about options?
Yeah, I just like I'm just a little freaking out right now. I don't know if I want an abortion. Like, what else?
Okay, yeah, that's what the appointment is for. You'll come in, confirm your pregnancy, and you'll speak with someone about the option.
Okay.
In which location would you like to visit?
Are you in Palm Beach?
No, this is Sarasota. Austin, we enter the phone calls for the other locations. Which one were you looking to go into?
Do you guys have West Palm Beach?
No, we don't. We have East Orlando, downtown Orlando, Kissimmee, St. Pete, Tampa, Fort Myers, Lakeland.
Let's do I'm trying to decide which one. Yeah, let's do that one. Would they be able to perform the abortion? Like, if I decided to do an abortion, would they be able to do that day?
No, that's a separate appointment.
That's a separate appointment?
Yeah.
What, how late's too late for you to get an abortion then? Like, I'm just worried that I'm on the edge.
For the pill, the pill goes up to 10 weeks. Anything that's more than the 10 weeks, it'll be the in-clinical procedure.
Okay. If I decided to keep the baby, do you guys have a doctor that I can see?
They can refer you out to so you can get prenatal services.
But you guys don't do prenatal care?
No, ma'am.
You don't do any kind of prenatal, like nothing?
No, ma'am. They can confirm the pregnancy. They can offer you an ultrasound, determine the length of the pregnancy. But for prenatal services, you'd have to contact your OBGYN office.
But they wouldn't be able to tell me, like, if the baby's okay?
No.
Okay, so how late, if I chose to do an abortion, how late would it, like, you said 10 weeks is the latest I could get it done?
For the pill.
For the pill. How much for the other one?
It's $550 for that one, and it's also for the in-clinical, the first trimester, 13 weeks and 6 days.
Okay, so what if I'm like 15, 20 weeks?
Well, that's different. It varies by the week, so the price would increase.
Okay. So like, and you said that I can't get it done on the first visit. I would have to do a second visit. What if?
Then is we can set up the appointment for the abortion. If you still wanted to come in and see the options, then that's a separate appointment.
Okay. So how many weeks is too late for me to have an abortion?
They only go to 20 weeks.
20 weeks, okay. Would I be able to like see the baby?
Sorry?
Would I be able to see the baby?
No, ma'am.
After it was born, I wouldn't be able to see it?
Ma'am, are you looking to set up an appointment?
I just don't know. Like, I just, okay. So what, basically all you can do for me is set up an appointment for an abortion, is what you're telling me.
If you want to speak to someone about options, we can do that, ma'am.
Okay, so what would the options be?
That's you to come in and you speak to the provider about the options.
Okay.
Or from there.
Okay. All right. How much will it cost?
It's $20.
It's $20?
Yes, $20.
Okay. Okay. I will talk to my boyfriend and see how soon he could get me to come in. So. Okay, thanks. Oh my gosh, I was pretty sure that she knew that I was like begging for answers. So I didn't want to like go too far with that one, but she was kind of a bitch. She was not so friendly. That was interesting. Okay, so oh shoot, I can't remember which number that one was. Okay, that was the 5500. So That was the Sarasota one. Oh, that one covered all of Florida. So even though online it says that there are 3 different clinics, they're not actually 3 different clinics. They're actually all the same. So, so we're just going to kind of combine them because I called a different number and it sent me to the main call center. So question number 1, can I come in for an ultrasound and make sure the baby's okay? No, they will not. They'll do an ultrasound, but they won't tell me that the baby's okay. They'll just tell me how many weeks the baby is. What if I don't want an abortion? They will refer me. Number 3, will your doctor see me for my pregnancy? She said a very avid no. What can you do for me then? An abortion? She actually wouldn't say. She said that she would schedule choices. What is it she actually said? She said that she would schedule a choices appointment or something like that. Yeah, she said that didn't she say she wouldn't let the woman see the ultrasound? Yes, that's actually true. She said that they would do an ultrasound, but we wouldn't be able to see it. So, and they would only check to see how many weeks the baby was. They wouldn't let me see the baby. And so they would schedule a options appointment. Number 5, if I say yes to an abortion, when's too late to change my mind? At 20 weeks. And then do they have therapists? I forgot to ask that question. And she was rude. She was totally rude. Yeah. Yeah, she said she would do an options appointment. Okay, so, all right. Let's call another one, guys. We only have 4 hours to do this because apparently Facebook Live cuts me off at 4 hours. So let's call Hawaii. If anyone can get me an actual number for Idaho to call, someone put that in here. Yeah, this is not illegal whatsoever. You can call any clinic and ask them what services they provide. This is not illegal to ask them these questions. I'm not threatening anyone. I'm not doing anything wrong in doing this video. I'm just simply asking the questions. Can these things, what things can I ask? So yeah, there's nothing that I'm doing that's illegal. There's no law saying you can't lie to an abortion clinic. There's no law saying that I can't call them and ask them information. And 589-1156. So I did call Utah, and they actually had the best answers out of all of them, except for they are willing to drive me 450 miles up to Salt Lake to get my abortion. That was an interesting call. But out of all of them, she was probably the most caring, and we do have the most strictest laws in Utah, which was actually very fascinating. Let's see. What did you say? Anyone call for answers, but many states require both parties to consent. Ooh, that's interesting. I did call that number for Idaho, and they're not answering. So, I'm gonna, 800. That's actually the main Planned Parenthood number, Carmel. If you can find me a valid number for there, that'd be great. Okay. So let's call Hawaii. No, I'll do Arkansas next.
I'm sorry. You have reached a number that has been disconnected or is no longer in service. If you feel you have reached this recording in error.
Okay, someone needs to find me a valid Hawaii number because the Hawaii number that I have is disconnected. So, disconnected. Okay. I called, we were going to try a new number for Idaho. Yep, that's a different number from what I have. So we're going to try that number, Pamela. 208-893. Please make sure that you guys are sharing this video so that people can see we're just calling clinics and finding out what they can provide to me as a pregnant woman. If they can provide me prenatal care.
Calling Planned Parenthood of the Great Northwest in the Hawaiian Islands.
Oh, I've called this one.
Para continuar en español, oprima número 1. If you're having a life-threatening emergency, please hang up and dial 911. To make an appointment or to speak with a representative, please press 0 or stay on the line. You may also book appointments anytime.
Ooh, they're actually giving me someone.
Thank you for choosing Planned Parenthood. This is Mary. How can I help you?
Hi, Mary. This is also Mary.
Hi. How can I help you?
It's a good name, right? Sorry, I'm nervously talking. Anyway, so I just found out that I'm pregnant, and I just haven't really like paid attention to anything. I haven't had a period since like Thanksgiving, so I'm pretty far along, I think. I've just been busy. I'm in school. Life is crazy. Anyway, I live in okay. I'm in Boise.
Okay.
And I need to know what services that you could provide to me. I don't know if I want to have an abortion quite yet. But can I get prenatal care until I make that? Just like I don't know.
Yeah. So how it would work is we would bring you in for an appointment. If you want to just come in for a pregnancy confirmation, and maybe an ultrasound, we could get you scheduled for that.
Well,
the other option is if abortion is still on the table for you, if that's something that you're considering, I would recommend coming in for the consultation appointment for that.
Okay.
And it is required by state law in Idaho to choose to do that service. At that appointment, they go over your medical history, they do an ultrasound, they do any labs they need to do, and they go over all of your options with you.
Okay.
And then if you choose not to continue on with that service, no harm, no foul. There's nothing wrong with that. But then they could at least do that ultrasound and get all that process ready for you. And if you choose to do that service, then you'll be set up to do that. Versus having to come in for an additional appointment again. Does that make sense?
So so let me clarify. I have to clarify in my head. My head's a little foggy right now.
No, that's okay.
So I can come in if I want an abortion or if I don't want an abortion, I can come in and get an ultrasound and check out the baby and make sure the baby's okay.
So they wouldn't be able to say anything about health or viability of the pregnancy. They can discuss only how far along the pregnancy is based on the measurements. But anything about health, viability, or gender, they're not able to do.
They wouldn't be able to tell me the health or anything?
It's the gestation.
Okay, and okay, that doesn't really tell me much. So, and if I did want to go ahead with, so what would the other options be? Like, really, like, would your doctor be able to see me if I wanted to continue with the pregnancy?
If you wanted to continue the pregnancy, they would get you started with the prenatal vitamins, do the confirmation, and then they would do some referrals for you for an outside provider that will continue on with that prenatal care for you.
So the prenatal care that you guys provide is basically like vitamins, and then you refer me to an OB.
Yeah, so they get you started with that, and then they refer you out to an OBGYN that you would see for the rest of your pregnancy.
Okay. And then I'm worried about how far along I am if it's too late for me to get how late's too late to get an abortion.
So did you have your cycle on Thanksgiving?
Yes. I was finishing up. I had my period while I was on Thanksgiving break.
Okay.
So, based on that information, they should still be able to see you.
Okay.
The health centers in Idaho go up to 13 weeks and 6 days. In some cases, they can go up to 15 and 5 if they're able to find a provider to do it.
Okay.
If you're past that time frame, once they do the ultrasound, they would have to schedule you somewhere else.
Okay. So where else would they schedule me if I was go past that?
It would likely you'd have to travel to a different state for that service.
Oh, I just go to like a different clinic in another state?
Mm-hmm.
Okay. So sorry, I'm just trying to put this and piece this together in my brain. Like, I want to make sure that I like have all the options in my brain and like I know what's going to happen. Like, well, I know this sounds really morbid and crazy, but like, would I be able to get a picture of my baby? Like a printout of the ultrasound or something? Or like, can I actually see the baby after it's born?
Well, you wouldn't see it after, no.
Why wouldn't I be able? Okay. Okay. Would I be able to get a printout of the ultrasound so that I can see it?
That's up to the provider's discretion. As far as I know, they don't typically do a printout of it, but that's something you may be able to discuss with them at the health center.
Okay. All right. I know, again, this is like a really crazy question to ask, but like, do you like have a therapist? Like, if like afterwards, like I'm super upset, like, do you guys like have a therapist that like a licensed therapist that I could see?
I mean, we don't offer counseling at the health center, but we do provide you with resources for it. A really good one is at exhale.org. If you go on there, they offer those services and counseling services and coping mechanisms, things like that, if that's something you're interested in.
Okay. So basically, all you can really do is do an ultrasound. You can't like tell me how viable the baby is or anything. All you can do is tell me the age. You can't give me a printout of it. And then I have another appointment with the doctor to actually do the abortion if I choose to go through with it. And I won't be able to see the baby after that.
That's correct.
Sorry, I'm just lining that all up in my head.
Mm-hmm.
Okay. All right. How much does it cost?
The starting fee for those services in Idaho is $660.
Say that again?
$650. $650.
Holy. Okay. All right. What if I can't pay that? Like, what if I don't have that money?
Do you have any insurance or anything?
No.
Okay. Then we can screen you on some income-based funding and see if we can try to lower that cost at all for you. And then we can also provide you with some phone numbers for organizations that fund appointments for services like that.
Okay. So basically, I would have to have the baby if I can't afford an abortion.
That's not what I said. I said there's organizations there that can assist you with that.
Oh, there's organizations. Oh, sorry. I thought you meant like that there were. Sorry. Okay. All right. It's a lot to think about.
Yeah, we have lots of information on our website at PlannedParenthood.org if you're interested.
Okay.
On all of the options, abortion, adoption, continuing the pregnancy, all kinds of information for you if you have any questions or concerns as well.
Okay. Here's a really super random question that just like popped in my head. Like, with the sliding scale, like how is that like how is that done? Like, do I just bring in like my stuff and like it gets subsidized, or is it those other foundations that pay for it, or what?
I'm sorry?
Never mind. I'll ask the question. I'll ask the doctor when I come in. I don't know. Okay. All right. I'm gonna talk to my boyfriend and we'll see what we need to do.
Okay?
All right. Thanks.
Bye-bye.
Ooh, I think I gave myself away near the end. I was like, oh. Yeah, pretty much. Okay. I tried to ask that question, Melissa. Melissa asked the question, income based, does that come from federal funds? I tried to ask that question, but I think she like sniffed out what I was doing. So I couldn't really keep asking that question. Yeah, I'm trying to be really careful. Okay. Memphis, Tennessee. Let me see if I've done Tennessee already. I've done a lot of states already, guys. Okay, so that was Idaho. And so question number 1, can I come in for an ultrasound to make sure the baby's okay? No. What if I don't want an abortion? They'll refer me. Will your doctor see me for pregnancy? No. If I say yes to an abortion, when's too late to change my mind? Does anyone remember how many weeks she said? Please comment. I can't remember. I can't remember how many weeks she said. So someone comment that. What can you do for me? You can give me an abortion. That's pretty much all they said. And then do they have therapists? Do you remember if they said yes on the therapists? No, they said that they would refer me to someone. Yep, it was 13 weeks. Thanks, guys. Thanks, Mary Claire. Make sure that you guys are reposting this video. I really want a lot of people to be watching this video. And then do they have therapists? She said no. So, all right. So let's see. Let's call. Oh, someone said another state. Someone wanted me to do Arkansas, right? Okay, let me call Arkansas. Arkansas. Okay, here we go. Thank you, Sierra and Kathleen, for sharing the video. I appreciate that. Okay, Arkansas. 913-312-5100. Let's check this one, guys.
Thank you for calling Planned Parenthood Great Plains, now serving Kansas, Missouri, and Oklahoma. For a company directory, please press 7. If this is a medical emergency, please hang up and dial 911. If you would like to visit us on the web, our address is www.ppgreatplains.org. Otherwise, please make a selection from the following options. Para español, oprima el número 8. To schedule an appointment or for information about health services we provide, please press 1. For media relations, public affairs, education and training, donations, or special events, please press 3. For human resources, please.
I think 1.
For information about or to schedule an appointment for an abortion procedure, please press 1. Thank you for calling. All of our representatives are assisting other patients at this time. For immediate scheduling assistance, we offer online appointment scheduling at www.ppkm.org. Just click on the blue Schedule an Appointment button.
I'm muting myself so that you guys can hear. I'm calling.
You are at position 1.
Yes, the number that I called actually said that they cover Arkansas, Missouri, and Oklahoma. So when I call this number, this is actually going to be for all 3 of those states. So I'm not going to be able to call any of the other 2 states because it's going to give me the same phone number. So I will make sure that I am watching which states we're calling so that we can do that. Oh, remind me, guys, I wanted to call Arizona next because Arizona is one of the few states that have all the way up until 40 weeks termination. I know that I'm going to cry on that one, so everyone just brace yourself because I know that I'm going to cry on that one. You guys have already seen me cry once. I'm trying to hold it together for the most part. Oh, hold on. We got someone.
Thanks for calling Planned Parenthood. This is Brenda. Can I help you?
Hi, Brenda. Okay. So I just realized that I'm pregnant. Like, who doesn't track this? Like, who doesn't track? Yeah. So, I'm pretty sure, like, I'm 9-10 weeks. I haven't had my period since like Thanksgiving. I took a test this morning. It did positive. I don't really know. Like, I know, okay, I know what the options are, but I don't know what I want to do. I, uh, um,
Deep breath.
I know, right?
Okay. Well,
Everyone's just,
the date of the first day of the last one, was that going to be, you said around Thanksgiving, 11/23 or so?
yeah, around then. Yeah.
Okay.
So
That'll get us kind of close. So if I go by that, let's kind of indicate here by that what you might be exactly.
okay.
That usually gets us pretty close going by the first day of the last period. So that would put you right now at right around 10 weeks.
Okay.
Okay.
Okay. I'm in Wichita. I'm out there in the middle of nowhere near my family, and I'm just like, I'm crazy. What am I doing? Okay, so, okay, so first of all, can I come in? Like, I don't want the doctor or whoever I see, I don't want them to assume that I want to have an abortion. Like, I don't know if that's what I want to do. I I know that I don't have time for I I'm 21. I life is just starting for my butt. Okay, so can I come in? Like, can I have like, can we do an ultrasound? Can I see the baby? Like, I don't know.
The only thing with that is the ones that we have are not regular ones. They do just like a still picture. It doesn't have any sound or movement or anything like that. And they do that usually when you do schedule for a termination procedure. They'll do the ultrasound at that visit just to determine exactly how far you are. You can go in for a sauna only, but it's only going to give you the age of the pregnancy.
So I won't know if like my baby's okay or not. Like, I don't know if it's okay.
Yeah, for that case, well, I'm not medical to really advise you on it, but as far as I know, it's just like I said, a still picture. No sound, no movement or anything for you to see or hear. So something like that, if you're wanting a normal one, you may want to go elsewhere for that part. So if you're not decided on what you're going to do.
So if
I would say if you just want to know how far you are.
So if I so if I don't want, like, if I decide not to have the abortion, if I decide not to have the abortion, like, can your doctors still see me? Like can they?
Yeah, they can see you. And like if you want to just do the sonogram and see how far you are and everything, and they can help go over options with you and stuff like that. If you did want to do something like that,
would they do like
ultrasound though? You'd pay, and then if you decided to do the termination, then you just go in and you have to pay in full and do another sonogram anyway. Is what I'm trying to point out to you. If you schedule for a termination, they're going to do the sonogram there. And then if you decide not to do it, you would only pay for the services you've done that morning and not have to stay for the procedure.
So they won't just do an ultrasound to see if the baby's okay?
They can do an ultrasound, but like I said...
But I have to go in and say that I want an abortion.
What?
So in order for me to get an ultrasound, I have to go in and say that I want an abortion, and then after the ultrasound say, never mind, I don't want the abortion.
No, I'm only telling you you'll pay for the ultrasound if you schedule for an ultrasound only. You'll be paying for that. And then if you decide to go and have one, you'll do another one anyway.
If all they're doing, they're not going to be able to check to make sure the heart's beating and the baby's okay.
Like I said, it's a still picture. It's a still picture with no sound or movement, just to determine the age of the fetus.
Well, I heard that you guys did prenatal. Like,
Okay, give me just a moment. They do have you come in if you want to go in. Like I said, they can do that. They can give you options, go over things with you. If you do want to continue and do prenatal services, they can refer you to someone. Give me just a moment. Let me make sure their ultrasounds at that location are the same as ours here.
I just muted her.
Just a
She
moment.
knows. She's putting me on hold because she knows. Make sure you guys are sharing this video. There's a share button below. Make sure you're sharing this video, guys. I'm doing this to make sure that people understand. I didn't call any of these phone numbers ahead of time. I had no idea what they were going to respond. I had an idea of what they were going to respond. I've been shocked by some of the things that they've responded. But this is so that there's no cutaway. You know the entire conversation. You know exactly what's being said. You know exactly their responses. This is not a cut video. This is a direct video of exactly what they're responding. I'm trying to get through all 50 states in the United States, but it's not. Some of the states are being very shady and they're not answering the phones. Like calling DC, I was on hold for 15 minutes. I never got an answer there. There was another one that I never got an answer from them as well. Thank you guys so much for all the hearts and for the thumbs up. There was a moment that I broke down crying. This is something that's near and dear to me. This is a picture of my daughter, Eliza. She died last year. And she was 12 weeks, and she was precious to me, and that was a baby that I really wanted. And someone who's pro-abortion tried saying that this was, it was just a piece of flesh, and no, she's not a piece of flesh. She's my baby. And even though I am pro-life, in my opinion, once the baby starts beating, that is, see, she's going to put me on eternal hold. We'll just go ahead and hang up. She's going to put me on eternal hold. She knows who I am. My baby died, and I was dying inside because my baby died. I could not imagine being that far along. I knew my daughter. I felt my daughter. I knew who she was. I could not imagine going in and intentionally killing my baby. I did ask a clinic if I could see the baby after it was done, and they responded that it was a piece of flesh. So video stopped. Oh no, I hope the video. Okay, good. I hope you guys still have feed. So I'm going to answer for Arkansas, Kansas, Missouri, Oklahoma. They are all the same clinic. I'm pretty sure they knew who at a certain point. I think I asked one question too many. So can I come in for an ultrasound to make sure the baby's okay? She said no, that it will be a still shot. It's a still ultrasound. There won't be any heartbeat or anything. What if I don't want an abortion? They would refer out. Will your doctor see me for my pregnancy? She said no. If I say yes to an abortion, when's too late to change my mind? Do you remember? I don't think I even got to that question. How far along it could be to have that. I don't think she answered that question. I think she sniffed it out too early, like she knew what I was doing. So I didn't get an answer for that question. And then I never got to the therapy question. So once she figured out I was asking questions, she put me on eternal hold. That's how they get people to go away. They put you on hold, right? That's kind of ridiculous if they just put you on eternal hold. Ask about bringing your daughter in that's impregnated by an older man just to make it all go away. Oh, that's a little scary for me. Okay, let's call LA. Let's call LA. Thank you, Diane. I appreciate that. Thank you, Taylor. Okay. So we're gonna call the LA clinic. Why not? 213-284-3200. All right, we're gonna try Eugene, Oregon afterwards. Thank you for sharing, you guys. That's a good question, Holly.
Planned Parenthood Los Angeles Administrative Office. If this
It's
is
the
a
administrative
life-threatening
office.
emergency, please hang up and dial 911. To continue in English, press 1.
That's a good question.
Planned Parenthood. Our administrative office hours are 8:30 a.m. to 5 p.m. Monday through Friday, closed weekends and holidays. If you know the extension of the party you want to reach, please dial it now. For patient and clinic services or to make or change an appointment,
Like
press
3 hours.
1. For development, to make a donation.
All right, to make an appointment, press 1. Oh, they hung up on me. I think my phone number has gotten around. I wonder. I had a feeling eventually my number would show up somewhere. I have a feeling that would happen at some point in this process, that Planned Parenthood would get alerted, and at some point Planned Parenthood would tell everyone to hang up on my phone number. So if you're watching Planned Parenthood, all I'm doing is asking you questions. That's all. If you really have nothing to hide, then you have nothing to hide. I'm going to try him back.
Thank you for calling Planned Parenthood Los Angeles. Our administrative office hours are 8:30 a.m. to 5 p.m. Monday through Friday, closed weekends and holidays. If you know the extension of the party you want to reach, please dial it now. For patient and clinic services or to make or change an appointment, press 1.
Press 1. There's got to be a mass email going out. They hung up on me again. Okay, I'm going to call the rest of the phone numbers that we can. It looks like it's very clear. They have found out that I'm doing this. And so I'm going to keep calling numbers. And hopefully some people are not answering their emails that they're getting from the main office. Okay, I'm going to try *67. 408 287 7532. I'm sure someone from Planned Parenthood.
Para español, por favor, oprima 7.
I'm sure someone's seen it.
If this is an emergency, please hang up and dial 911. To speak to a representative, please press 1. To find the nearest health center, press 2. To reach one of our education and administrative offices, press 3. Please listen carefully as our options have changed. For reproductive health issues such as birth control, STI testing or treatment, and annual exams, press 1. For primary care concerns such as diabetes, hypertension, cough, cold, or physicals, press 2. For abortion services, press 3. Your continued participation is your consent to the possible recording of this call. All of our agents
keep sharing this video, guys.
Your call will be answered in the order.
I'd like to see the Blaze pick this up, because you know the Blaze would take this all over. So keep sharing this, guys. Keep sharing this on all of the media sites. If you want to get a hold of a member of the media, let them know that I'm doing this. Please tag them. Share the video with them. Share the video with them. Let them know what I'm doing. Try to, I know, diabetes. That's a new one.
And see most test results online.
Make sure you're sharing this. Make sure people see this. This is not a cutaway. This has been a full video of me doing the entire thing. I want to see people seeing this. I want to see the email that they've sent.
This is Jamila. May I have your first name, please?
Hey, my name is Amber.
How may I assist you, Amber?
I'm an idiot. I'm pretty sure that I'm pregnant. I took a test and it says that I'm pregnant. I haven't even like tracked my period. I'm pretty sure I haven't had a period since like Halloween, maybe. Anyway, I don't know if I definitely want to have an abortion. I want to come in and get checked out. I want to make sure, I want to see if the baby, I don't know, like has all its arms and legs and all that. What I know that, let's be real. Everyone knows that Planned Parenthood does abortions, but what else can you do?
Well, if you're not sure if you're wanting to continue the pregnancy or not, I can schedule you for a pregnancy test appointment, and it also includes an options counseling.
Okay.
So if the test comes out positive, they sit down and they talk to you and they explain all of the options that you have.
Okay.
It does not include an ultrasound. The ultrasounds are considered prenatal care, and that has to be ordered by a prenatal provider. If we would just provide you with the proof of pregnancy form with an estimation on the length of your period based on the first day of your last normal period, but you don't know when that date is.
Yeah, it was like sometime in October.
Okay. If you're leaning toward, I heard you mention Halloween.
Yeah.
And 31. If it was around Halloween, you're over 13 weeks. You're 13 weeks, 3 days.
Okay.
That's how we would determine or estimate the length of your pregnancy without doing an actual ultrasound. If you choose to go the abortion route, an ultrasound is included in that visit only because we need to know exactly how far along you are and whether or not it's safe for you to do the option.
So the only way to get an ultrasound is by doing an abortion.
That's the only way that we're able to offer them in the center.
Okay.
The ultrasound for prenatal care, if you were getting prenatal care through Planned Parenthood, the doctors order them, but it's done at a diagnostic center, so it's a referral.
Okay.
But for the abortion service, it would entail an ultrasound, it would entail blood work, and a consult. So we would perform the ultrasound to know how far along you are, to know if it's safe for you to do it.
Okay.
Your blood work tells you if you're Rh negative, if we're required to give you a shot before doing either option. And then the consult, we break down the options to you. If you decide to continue with the abortion process during that consult, we'll continue the appointment.
Okay.
If you decide that you do not want to do it, you're going to continue your pregnancy, we offer you information on how to obtain prenatal care.
Okay. So can I, do I get a copy of the ultrasound? Like if I wanted a copy of my baby?
Most patients don't want one, but we can provide one. The machines do print them. You just have to let them know that you want one.
Okay. If I know this sounds really morbid. If I were to go through with the pregnancy, like if I was to go through with the abortion, could I see the baby after?
That is something you'd have to discuss with the provider. I honestly don't know. But you discuss that during the consultation, I'm sure. And then if you're choosing to do the surgical procedure where they remove the pregnancy vaginally, you can discuss that with the doctor that's performing the process. If you're doing the you're too far for the medication. You would have to do the procedure. So I would definitely ask them. If that's something that you're interested in, you can ask them during the consultation and they'll let you know if that's
allowed. I don't know. I honestly don't know if they do that or not.
Okay. This is just really hard for me. Like, I don't know. Like, do you have like a therapist like on site, like for like post, I don't even know how to term it, like post abortion service therapy?
After the abortion service is completed, if we have quite a few women that it's rough. It's a hard time for them after the fact. So, I mean, we do a like a recovery period where you sit in the room and they monitor you for a while. We don't just send you home once it's done. And they talk to you during the recovery period. But we also provide you contact information to a company called Exhale. They do kind of the over-the-phone counseling with you, help you with however you're feeling after the process is completed.
Okay. Okay. So how far along before, because I'm pretty far along, right?
The 13.3 weeks, we're still able to provide the service. It's just going to require more than one visit because you're over the time frame to have everything done in one day.
Okay.
The California state law is 24 weeks.
24
we don't
weeks.
go that far. We only go up to 19.6. So you still have time if you're choosing that option.
Okay.
If not, you're right at the time frame to start prenatal care. So if you're wanting to continue the pregnancy, you're at the time frame where they would start seeing you on a regular basis.
Okay. And then you would just refer me to someone else. You can't see me in the office.
Not for prenatal, because at this time, we're completely full to capacity with our prenatal patients. So we're not taking in new patients at this time. But we would give you the proof of pregnancy form. I don't know if you're insured or not, but if not, we'd give you the proof of pregnancy form to take down to Medi-Cal, and that's how they would start your prenatal insurance. Or if you have private insurance, you would submit that to your insurance company, and they would adjust it to cover your prenatal costs. And then whoever they contract with, those are the providers you would contact to see if they're taking patients or not.
Okay.
A lot of information. I'm sorry.
That's a lot to think about. Like, does it matter? Like, oh my gosh. Does it matter? Oh, yeah. My mom's gonna kill me. Oh my gosh, my mother's gonna kill me. Okay. Whew. Sorry,
It's okay. Do you want to schedule an appointment for the options counseling? That way you can sit face to face and talk with someone?
Well, here's a really, this is a sucky question. Sorry, I just almost puked everywhere. Pregnancy. It happens. I seriously thought I'd been sick this whole time. Like, I just thought that it was the winter flu. So I'm 16. I'm going to be 17 in like 3 weeks.
Okay.
Does my mom have to know?
No, services through any provider, reproductive health is confidential, and by state law, we can't release any of your information to anyone other than you.
Okay, good. Like, I just don't want my mom to know. Like, will I be like bleeding like crazy afterwards?
It depends on the woman. Every woman is different. So your body may not respond the same as Sarah or Brittany or whoever else comes in. Some women will have a completely regular period after, and then it'll stop. Other women tend to bleed longer. Some women can bleed for several weeks after. It should not be excessive. It should be like a regular period.
Yeah. Okay. How much is it?
Well, if you're paying out of pocket for the abortion service over 13 weeks, it's $690 to $1,245, depending on your income. So being 16, 17, it would be the $690 more than likely. But you'd have the option to apply for a program. You're worried about confidentiality, so you can apply for minor's consent. That would require you to go down to the local Medi-Cal office and ask for minor's consent. Can't say Medi-Cal because Medi-Cal is something completely different.
Okay.
You need to ask to apply for minor's consent. It's a 30-day temporary Medi-Cal that covers the cost for the abortion service, and it does allow for confidentiality.
So that my mom doesn't know, I can go to an office. I can apply for minor's consent.
Mm-hmm.
They'll register me for Medicaid that will pay for it so that my mom doesn't know.
Correct. It allows for confidentiality, so you're not having to put down parental information on the appointment. If you submit parental information, you may not be eligible because they make too much money.
Okay. I gotta talk to my boyfriend. I have no idea what I'm gonna do. Okay. I will call you back. I gotta talk to my boyfriend. Oh my gosh. Okay.
We are here until 6 o'clock.
Okay, thank you.
You're welcome.
Are you flipping kidding me right now? Wow! She even told me step by step how to, as a 16-year-old, get away with having an abortion without my mother knowing. That the government is going to pay for. That I'm going to register with a government insurance to pay for this abortion. Are you serious right now? Like, seriously! Like, if you haven't shared this, share this. There's 114 of you on here right now. Share this video. This is ridiculous. Like, oh my gosh. That was the San Jose clinic that I just talked to. Oh my gosh. Wow. Told me how to, as a 16-year-old, to get Medicaid without my mother knowing about my abortion. Wow. 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 Wow, you guys, like, wow. Wow. Whew. How much time do we have left? All right, we have 40 minutes for me to try to call as many clinics as I can. Facebook cuts you off at 4 hours. I will start another video if we have to start another video, or I may pick it up tomorrow. I literally was not lying when I said I was going to throw up on the phone, because I seriously feel like I'm going to puke. Like, whew. Oh, Sunny, there was a moment in this video that I actually did bawl my eyes out on the phone with the lady because I was mortified by the things she was saying. Can I come in for an ultrasound to make sure the baby's okay? She said no, correct? What if I don't want an abortion? They'll refer me. Will the doctor see me for my pregnancy? No. What can I do for me? An abortion or referral? If I say yes to an abortion, what's too late? Did she say 25 weeks? Someone remind me. Did she say 25? She said 24 weeks. I'm just asking, Regina, I'm just asking if I get an abortion. This was actually the only one that I've actually asked as a minor. This is actually the only one that I've asked as a minor, and I couldn't believe the answer. I now have had 3 clinics block my number at this point, and so I want to try to call as many as possible. Okay, so you said 24. Thanks, guys. And do they have therapists they would refer me? Okay. So they hung up on me. Okay, so LA hung up on me. Sacramento hung up on me. Kansas we called. Arizona. We were calling Arizona next. I know that was one that a lot of people really wanted to see. You just missed a call. Watch this whole video. Awful. Yeah, it's pretty intense, guys. Okay, so we are going to call Arizona. We're going to check out Arizona. Okay, what's the *67, guys? *67 to block my number, because apparently Planned Parenthood has sent an email around telling them that I'm calling. So they are not answering any calls from my phone number. So I'm trying to block my phone number so no one knows what my number is. So people are more out to maybe talk to me.
Thank you for calling Planned Parenthood Arizona
Yes, we have.
Service Center. Para español, favor marque uno. Please listen carefully as the menu options have changed. Please be advised that your call may be monitored or recorded for training purposes. At any time during this recording, press pound to return to the main menu or press star to return to the previous menu. To be connected to a customer service representative, to make a new appointment, cancel, or reschedule an appointment, please press 2. If you're an existing patient and would like to order your birth control, to set a new appointment, press 1. To cancel or reschedule an appointment.
Your queue position is first. Estimated waiting time is 1 minute and 20 seconds.
If you would like to hold your
Okay, so I'm on hold for Arizona.
Call you back. Please press 1.
I know, right? If they have nothing to hide, why are they blocking my number? Why are they hanging up on me? I've already done Texas, guys. Wait, no, I haven't done Texas. I'll do Texas next. I've done North Carolina, and they're a no-go.
Need an annual checkup, or you went to see about that rash?
Yeah, this is a very fascinating call that I'm doing. I want to make it very clear, you guys, I'm not posting this as someone that is pro-choice, even though I am pro-choice. I am just posting this video. This is not about abortion being right or wrong, even though me personally, I feel that it is wrong. It's about seeing what Planned Parenthood really does, and do they really do prenatal care? I've probably called 25 already, and only one has done prenatal care, and their idea of prenatal care is give me prenatal vitamins and refer me to an OB. Oh, there we go. So I'm asking them a specific list of questions, and then I'm recording their answers. I will have this all available afterwards so that you guys can see what I've actually commented and seen.
We now provide primary care services.
This is really frustrating for me. There's some that I can tell are intentionally putting me on hold for extended periods of time. Every time that I've called one and they once oh wait, here we go. I'm sorry, I can't hear you very well. Hello?
Yes, ma'am. How can I help you?
Oh, okay, so I'm pregnant, obviously. So I don't know what I'm gonna do. My mom's gonna kill me. I just don't know what I'm gonna do.
Okay, do you know how far your pregnancy is? When was the first of your last period?
It was around Halloween. I was just hoping that like something was wrong. My friend told me today that I needed to get a pregnancy test. I did. I'm fat, so I didn't think anything. I don't look pregnant, but I'm positive. I don't know what I'm gonna do. My mom's gonna kill me.
Yeah, and and
you considering, because we can go ahead and schedule you for an ultrasound so that we can confirm exactly how far the pregnancy is and then go over all your options in education. Is that what you're looking for?
Yeah.
How old are you?
I'm 16.
Okay. So yeah, we can see you for that, for like I said, for the ultrasound, and then go over all your options in education, and then from there, depending on what you decide to do, we can go ahead and schedule your next appointment.
So like if I ended up being pregnant and oh my gosh. I know that I'm pregnant. I mean, I'm kind of in the denial. I think I'm in denial. I'm in denial. Yeah, for sure. Okay. I'm pregnant. Okay, I know that I'm pregnant. Okay. 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 Okay, first, can I like get an ultrasound? You said I could get an ultrasound.
Yes, we can. We can go ahead and schedule you so they can perform an ultrasound, confirm how far the pregnancy is exactly, and then go over all your options in education. So basically, it's like counseling, going over your options in education.
Okay. So like, would I get a copy of the like, could I see the baby? Like, could I make sure the baby's okay?
Ultrasound. I'm sorry?
Could I like make sure the baby was okay?
Yeah, we don't check for them. You will have to go to a gynecologist for that. Our ultrasounds are only to detect how far the pregnancy is. We won't be able to check the healthy of the baby.
So, if I didn't do an abortion, would you guys be able to continue seeing me? Like, how would my okay? What what would I do? Like, pretty much my only option to not let my mom know would be to not have the baby.
Okay, yeah, like I said, they're going to go over all your options when you come in. They'll let you know what options you have depending on how far the pregnancy is.
Okay. Like, could you tell me oh my gosh. How much is this going to cost? Like, I don't have any money. I don't have a job.
The ultrasound is $80.
Okay.
Do you have insurance or?
My mom has me on her insurance, but I don't want her to know.
Right, yeah, it will be $80 out of pocket for the ultrasound.
And how much for the abortion?
Abortion services, they range from $520, they go up to $1,200 depending on how far the pregnancy is.
Like, is in 1,200?
Correct.
I don't have that money. Are you kidding me? Um, what would I do? Oh gosh, what could I do?
Yeah, they'll go over, there is funding available. That information will be given to you at the health center when you go in for the ultrasound. If you qualify for the funding, the price will be reduced, but it's not going to be free though. It's just going to be reduced to a lower cost.
Okay, so, well, how late's too late for me to change my mind? Like,
so for termination services, we only got to 16 weeks now. And then you said that your last period was around Halloween?
Yeah.
That's when it started?
Yeah. Well, I just know that I was on my period during Halloween.
Okay. So yeah, today is already February 2nd. So if that is accurate, you will be around 14 weeks.
Yeah. So I'm kind of freaking out right now.
Yeah, I can go ahead and schedule your appointment so you can come in for the ultrasound. Would you like to do that?
Well, what am I? If I'm at how far along you can do an abortion, I'm pretty screwed, right?
Well, we go up to 16 weeks now. If the day that you gave me is accurate, they will confirm it what day you do the ultrasound. You still have till the 17th.
Okay. And my mom's not going to know.
Well, if you're not 18, you will need a parent consent if you want to have an abortion.
I will?
Or you can get a judicial bypass from the court. And you will have to see the judge, so he will decide if you're
But my mom would
able
know.
to have an abortion without a parent consent.
But my mom would know. Oh. Yeah, there's kind of no point in having an abortion if my mom knows anyway. Oh. This is horrible. What am I going to do? Ugh. Well, if my mom knows anyway, then like she'll make me give up the baby for adoption. I know it. Would you guys be able to keep seeing me as a patient?
So if you're wanting to continue with the pregnancy, we can refer you out to an OBGYN.
Okay.
We do have referrals for OBGYNs, yes.
So what are my other options for what are my options? Like,
so the options that we usually offer our patients is either parenting, adoption, or termination services.
okay. And so if I do adoption, you would like oversee that, or?
Yeah, we will refer you out. We will refer you out to a provider that will assist you with adoption services.
And then same thing with the OB.
Correct.
Okay. So you don't provide any kind of prenatal care there?
We don't.
Okay. Okay. Well, all right, I'm going to talk to my boyfriend and see, and I'll call you back. So I'm pretty much on the edge of being able to do an abortion, though.
Right, because you're around 14 if that's accurate.
So if I wait another week, it'll be too late.
No, like I said, we go up to 16, so you still have 2 weeks. But appointments for ultrasounds are not right away. They're till like towards the end of next week.
Okay.
And then there's a 24-hour window that we have to wait to continue with their termination, so it's not going to be done the same day you come in for the ultrasound.
Oh, crap. Okay. All right. I'm going to call my boyfriend, and then I'll call you back.
Okay, thank you for calling.
Okay.
Have a great day.
Thank you.
Bye-bye.
Well, at least Arizona, they won't do it without my parents' consent. Oh, wait. I can go in front of a judge and get that. What the... I should have been asking the underage thing this whole time. I really should have. Okay. So the questions. Can I come in for an ultrasound to make sure the baby's okay? The answer was no. What if I don't want an abortion? They're going to refer me. Will your doctor see me for pregnancy? No, they'll refer me. If I say, what can you do for me then? An abortion. And that's pretty much it. Number 5, can I say yes to an abortion when it's too late to change my mind? How originally she said 14 weeks, and then when I said I was about 14 weeks along, she actually changed that and said 16 weeks. So I'm gonna say 14/16 question mark, because I've already done Utah, Melissa. I've already done Ohio. I believe I have already done Ohio. Let me double check, make sure. Let's see. We have done, I'm going to list off everywhere that we've done, guys. We've done Arizona. We've done Arkansas, Missouri, Oklahoma, Kansas, California. Actually, California hung up on me. LA hung up on me. Sacramento hung up on me. San Jose gave me crazy information. Orange County gave me, Orange County, San Bernardino, California. Pasadena, California, we've called them. Denver, Colorado, we've called them. Connecticut, we've called them. Delaware, we've called them. Washington, D.C., they put me on hold for 15 minutes and refused to talk to me. Sarasota, Florida, they hung up. They were rude. They were really, really rude. I've talked to Georgia. I've talked to Hawaii is disconnected. Idaho, I've talked to Idaho, which is actually, it's Idaho, Washington, and Oregon. They're all combined together. I've talked to them. I've talked to Illinois. I've talked to Missouri. I haven't talked to Indiana, so we need to call Indiana still. We've called Kansas. We've talked to Kentucky. Oh yeah, we were going to do Texas next. Okay. Planned Parenthood of the Gulf Coast. That's an interesting title for it. Okay, guys, we only have a half hour to call as many as possible. Make sure you're sharing this video. If you have connections to media, I beg of you, please let the media know that I'm doing this. Let them know. Say, look, there's a lady that is calling every abortion clinic in the United States to find out what services she's going to get. And it's a full video. It's full video of the questions I asked.
Thank you for calling Planned Parenthood's Administrative Office.
Oh, it's an administrative
Select
office.
from the following menu options. To schedule an appointment in our health center, press 1.
There we go.
For family planning appointments, press 1. For surgical services appointments, press 2.
I love how they call it surgical services appointments.
Thank you for calling Planned Parenthood Center for Choice.
I know.
Para español, oprima el uno. If you have an emergency that requires immediate medical attention, please dial 911 or go to your nearest emergency
Thank you,
room.
Kelsey.
For abortion appointments, press 3. For all other appointments, press... Good afternoon. Thank you for choosing Planned Parenthood. My name is Andrea. How may I assist you today?
Hey, Andrea. So I just found out that I'm pregnant and my mother's gonna shoot me. Oh my gosh. What am I gonna do? Okay. So I'm an idiot and I had sex with my boyfriend. And we only had sex one time. I swear to God, I thought that we were gonna be fine, and now I'm pregnant and my mom's gonna kill me. I don't know what I'm gonna do.
Okay, let me see what I can help you with. May I please have your name?
Amber.
Is it okay if I call you Amber?
Yeah.
Thank you so much, Amber. And what is a good phone number to contact you in case we were to get disconnected?
It's 505-321-1248.
Thank you. So it's 505-321-1248?
Yes.
Thank you, Amber. And are you looking to come in for a counseling session, or what services is it that you're looking for?
I don't know. My mom's gonna kill me when she finds out that I'm pregnant. Oh my gosh, she's gonna kill me. I don't know what I'm gonna do. Honestly, I don't know what I'm gonna do. I'm leaning towards abortion. That's kind of why I call Planned Parenthood. I love how I said that, like whispering, like, yeah. But like, I don't know. I don't know what I'm gonna do. I don't know what I'm gonna do. Like, okay, so so what can you guys do? Like, can you just do abortions? Is that all you really do? Like, give it to me straight.
What services is it that you're looking for?
I don't know what. I really think that there's really only like 3 options, right? Like, keep the baby, have an abortion, or give the baby up for adoption. That's pretty much the options, right?
So it sounds to me like you may be interested in knowing about other options than just abortion. Here at Planned Parenthood, we can offer you a counseling session, so I'll be happy to help you schedule that, Amber.
Okay.
So that you can discuss your options with a counselor. Would you like to do that?
Yeah, that'd be great.
Absolutely.
Okay, I just hung up on her. She knows exactly who I was. She knew exactly who I was from the beginning. She knew way too much. She knew so quickly who I was. Like, when she asked for the phone number, I'm like, no other person has asked for my phone number. No other person has asked for my name. Like, she knew who I was. curious. I'm curious about the email that's going around right now. Yeah, exactly. There's a counselor you can talk to. Let's get you in touch with a counselor. And I'm hanging up on you. Um, yeah, exactly. Everyone's watching. At this point, everyone at Planned Parenthood knows what I'm doing. I know that they know. I've tried to call as many as I can. They keep the longer this video's going, the more they know. I'm sure that the news knows now. There are a lot of things that people know. Um, yeah, they know. I've already called South Carolina, Jeremy. That was actually one of the very first ones that I did. Hey, kitty, get out of here, you. It was actually one of the first ones that I did. It's very clear that they already know. Use a different name. I used a different name. The first one I give him like Tiffany or something on another one. I think I gave him a different name before. But I'm pretty sure that I'm pretty sure that they know. And so I wanted to keep calling, but in the bottom line is I ended up calling about 30 to 35. I think I called about 30, 35 clinics. I'm going to add it all up here in a minute. I want to kind of wrap up this whole video and let you guys know what is going on. So I did this video with the intent of giving you full disclosure, full knowledge of what I was asking the Planned Parenthood clinics. There was a video that kept going around in the past week about defunding Planned Parenthood, and there were like clips of people going into clinics and things like that. But I was like, you know what? But what is the wording that they're saying? Um, Almost every Planned Parenthood that I talked to said that they didn't have prenatal care. Only one said that they had prenatal care. The one that did say that they had prenatal care, their prenatal care was giving me prenatal vitamins and referring me to another gynecologist. Um, all of them did say that they would give me options counseling, which options counseling basically said if you want an abortion, we can help you. If you don't want an abortion, we can refer you to an adoption center or an OB. And that was pretty much the bottom line on almost every phone call that I made. There were some that were out of this world crazy responses. One of the ones that made me cry was when I asked them if I could see the baby after it was aborted. If I could see the baby, they actually told me that I couldn't because it was just going to be a bunch of tissue. That was really, really crazy. Um, yeah. Like even if they knew that I was doing these calls, they shouldn't be trying to block me from calling. They should be upfront and honest. If they really have nothing to hide, there should be no reason why they're blocking my calls. So I just really wanted to do this video so that people understood what was going on. I really want you to continue sharing this video, continue putting this out there. I will get this video uploaded onto YouTube so that you guys can have a wider way that you guys can share this. Keep an eye on my Facebook page. I'm probably going to do some more videos like this. Just click the follow button on my Facebook, and then that way when I do another video like this, maybe tomorrow I can call the other places, or maybe sometime next week when they aren't like alerted that I'm doing it. So make sure that you do that. And thank you guys so much for watching. I really appreciate you guys hanging in here for 4 hours with me. It was actually, there were times that I cried. There was times that I wanted to kill the person on the other line. Not that I want to kill anyone. Okay, let me rephrase that. I was very angry with some of the things that were said. I was very hurt by some of the things that were said. There were some of the things that were said made me really want to cry that people actually call and do this. I was actually really shocked and appalled by some of the responses. And so I really want you guys to get this video out. I want you guys to share this video like crazy. Send this to everyone you know. Just say, hey, there's a lady that called a bunch of, Planned Parenthood places. I didn't have an agenda. I mean, granted, am I pro-life? Absolutely. Do I personally feel that life starts the second that the sperm meets the egg? Absolutely, I do. But that had nothing to do with this call. These calls were meant to show what these calls were meant to show what Planned Parenthood really did for people. If you go to Planned Parenthood and you're pregnant, what really would they do? And I had a lot of insight that was really interesting. My name is Mary Ellen Crase, Crase. And so Mary Ellen, 2 words. Right now, my Facebook profile picture is an eyeball. And so please go on my Facebook page, um, follow me, and I will probably do some more videos very similar to this. And thank you guys so much for going along with this journey and seeing what Planned Parenthood really would say. And thank you guys so much. I appreciate you all. I love you all. I love our babies. I love our babies alive and dead, and those babies that are passing away. Um, and people that don't feel like they have another option, there is another option. And I love you guys, and we'll see you guys. Bye. Thank you guys all for coming on. I appreciate you all.